And we're live.
Okay. Good evening. Welcome to the public work session, followed by a public business meeting of the Rochester Community Schools Board of Education. So first up, I would like to invite my colleague, Scott Muska, to please lead us in the Pledge of Allegiance. Scott.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thanks, Scott. Again, welcome to those of us, those who are with us on Zoom, and also to those who are watching on YouTube Live. Welcome to our work session and our meeting. Due to Michigan's stay at home, stay safe executive order, the work session and meeting are being held virtually. And I wanted to make a note about that right up front about the irony of having a virtual work session to talk about returning to in-person school. So to meet in person, we would have had to heavily restrict the capacity of our audience. And instead, we looked at this format, which is remote, as an opportunity to present much needed information to as many people as we can in the community in real time. So we have visited our schools in person, and we do look forward to an in-person meeting hopefully soon. So tonight's format is slightly different than our normal public meeting, and I wanted to explain that. So we'll have several periods, first of all, for public comment. First up on our agenda, we have a spot for those who have submitted a request in advance to speak. And tonight there is one person who has requested to speak at that time. We've also made time for public comments after our work session. We anticipate the work session itself taking about 90 minutes to 2 hours, maybe less, maybe more. And we know there are many questions out there. We hope to answer most of the questions during the presentation amongst the presenters and questions from the board. When we wrap up though, we will have a period for public comments. So if you want to speak at that time, please hit the raise hand button in Zoom and we will unmute you. Between the work session and the business meeting, we'll have a quick 5-minute recess. You don't have to log out and log back into Zoom at that time. During the business meeting, we do have time for public comment as part of each action item, as well as comments at the end of the meeting. So in all of our comment opportunities, you have 3 minutes to speak. When addressing the board, please state your name and your relationship to the district. Once again, on behalf of my board colleagues, we're grateful to serve this community and appreciate your support. First item on the agenda is roll call. And tonight, all of our members are present. Next up is communications, and first item under communications is Secretary of the Board of Education, Michelle.
Good evening. First, I wanted to explain that all of the correspondence that is in the board packet are those that come through the official Contact the Board page on the RCS website by noon on the Wednesday prior to the meeting. That page includes a disclaimer that lets the writer know that the email will be included as part of the public record in the board packet. So through that communication, through the official Contact the Board page, we received 27 email communications since our prior meeting. District parents, Eric Engblom, Justina Maslowski, Jessica Drzezinski, Danuta Kukulka, Elena Dinverno, and Christina Hermes addressed the board regarding feedback on remote learning. District parent Sarah Pogasic addressed the board regarding student assessments. District parents and students Matthew Mullen, Jill Kitka-Leonard, Rosemary Hanan, Erin Arnaz, Leah Barnett, Sarah Romaine, Jennifer Mole, Allie Miller, Anel Ledesma, Haney Selman, Scott Struzik, Julia Heiser, and Martin Nika addressed the board regarding return to school. District parents Erica Thomas, Tracy Rana, Erin Arnaz, Laura Kassar, and Douglas and Teresa Walser addressed the board regarding long-term rentals. Jennifer Fredenberg, a district parent, addressed the board regarding Wellness Wednesdays. And district community member Mary Purcell addressed the board regarding curriculum content. We also had The board also received communication that did not come through the board website, and these included one from Nicole Goldstein, Janice Solhan, Clark Skinner, Jason Strobel, and Julie Stalker regarding returning to school. We also received one from Meredith McCutcheon regarding communications from the school, one from Sarah Roselle, a teacher, thanking the board for their time and work, and 2 emails from Jessica Patelka-Opfer regarding remote feedback. And I think that ends our communication that we received as a board.
Thanks so much, Michelle. Next up on the agenda, we have citizens requesting placement on the agenda. We have one citizen who has requested to speak to the board, Lori Baggett. I don't see Lori. I don't see Lori as an attendee here. Okay, I don't see Lori as an attendee here. I don't, if it's a technical issue on Lori's end, I can look for her in a minute. If the rest of the board doesn't have a problem with that, we can go on with our agenda. Members of the Board of Education, any board members have anything that they received for communication that wasn't already mentioned? Michelle.
I received 4. I received one from Summer Ray, Barb Sobsak, and Jennifer Hinkle regarding feedback on returning to school, and also one from Sheila Thompson, which was a thank you.
Thanks. Andrea?
Yeah, I received several emails from the community this week. I responded to all of them. A couple of them were addressing return to school, a couple of them thanking the board. I responded to each one of them, copying the board and either directing them to appropriate staff or answering questions on our own.
Thank you. Anyone else? Barb?
I'm not sure if you mentioned this already or not, Michelle, but Morgan King reached out regarding interviewing a board member for his political science class, and then a Jennifer Enkees.
Anyone else? I think I'm missing. Mike, did you have anything? Kevin? Scott? I received several emails. Again, like Andrea said, replied to them. Most of them have been named here. And I still don't see Lori as an attendee, so I apologize, but at this point, we're gonna have to move on with our agenda and I will try to catch up with her. So moving on, next item on the agenda is our work session. So this is where we're going to talk about one item, which is our extended COVID-19 learning plan update. And there are 3 basic buckets of information that we'll be presented with: health and mitigation, operations and facilities, and curriculum and instruction. And I'm going to hand it over to Dr. Shaner. And I know that there might be some instructions because I know there's going to be a screen share and a slideshow. So Dr. Shaner, go ahead and take it away.
Thank you, Madam President, and appreciate everyone that's on the call with us today, particularly members of our task force and our staff. They're going to help us with this presentation. As President Bull mentioned, we'll have a brief introduction. We'll talk about health and mitigation, operations and facilities, and curriculum and instruction. And through each of these buckets, we'll stop at the end and ask the board to entertain any questions you might have. Just as a point of reference, Lori, next slide, thank you. One more. I'd like to start out with a timeline. I think it's important to just take a moment and reflect and look at the body of work that's been done since last February and the constant state of change. I know many of us, me included, like a sense of certainty, but since last February, almost nothing has been certain. And you notice through this timeline that there's been a large body of work that has been done as we continued through remote learning last spring, planning through the summer for in-person / remote, as well as standing up a virtual campus and participating in the governor's return to school advisory council. And again, if you're just for point of reference, we started this this odyssey last February 27th. We closed. We moved to closing school March 12th, and we have been remote in some shape or form ever since. And we have been operating a task force since then. June the 2nd, I was appointed to the governor's Return to School Advisory Council. And it's important to note that we finished that body of work advising the governor on June 30th. And at that time, it was popular belief that we'd be, by July 4th weekend, we would be in phase 5. As everyone knows on this call, that we did not come out of phase 4 and still remain in phase 4. And we continued our work as a task force to plan for the many contingencies that we were going to be faced as we came up on a new school year. We also conducted some market research during that time, as well as some thought exchanges to prepare and get feedback from the community. As we went into the school year, you might recall that we did not have a seat time waiver, and we did not have a waiver from the days, minutes, and hours requirements that are required by pupil accounting for funding for the state of Michigan. And August 20th, the governor signed a group of bills known as the Return to Learn legislation. A couple of points about that legislation. I was vocally opposed to that legislation, and just as for the board's digestion, if you remember at that time, that legislation includes benchmark testing for kindergarten to 8th grade. Our school district already engages in benchmark testing, but in terms of requiring that and legislating it, we felt that was not an appropriate piece of legislation at that time. That legislation also requires us to submit an extended COVID-19 learning plan to the state by October 1st, and then to recertify that plan each month afterwards. And that's what we're doing, or we're going to ask the board to do this evening. Let's talk a little bit about our phased-in approach to in-person timeline. And again, we started school September 1st. The Friday before Labor Day, the governor she seems to like to have a habit of, is issue executive orders at 3 o'clock on Friday afternoons for some reason. But the Michigan High School Athletic Association, after her executing a number of executive orders, reinstated fall sports, and we began phasing in high school athletics starting September 8th. On September 11th, I had a governor's Return to School Advisory Council meeting. And at that point, we had a conclusionary meeting, and we were told that they would call us if they needed us after that. I just want to really speak real quickly about the governor's Return to School Advisory Council. Quite often, people ask me, how did that work? What was that like? It was advisory, and that is a key word in that phrase. And I'll tell you why. From the get-go, the governor let us know that we were advising her, and that the return to school plan would be her plan, and she would put it forth with her ownership. So there are things that we advised the governor on that she listened to, and there was things that we advised the governor on that she chose not to listen. So it's really important, I think, for the public to understand that there wasn't a vote. There wasn't one person that had more influence than another, and there were people from across charter schools, Michigan High School Athletic Association, private schools, and a large body of people from public health and medicine. So as we continued our phase up, you can see from the timeline that we continue moving deliberately. September 21st, we started middle school athletics. We started general education pre-K programs on the 22nd. And this past Friday at 3 o'clock, the governor issued an executive order requiring all students in grades kindergarten and up in regions 1 through 5 to wear a face covering at all times. So we've got that direction, and something we continue to work through. Also, part of that executive order was reporting requirements in terms of infected people entering our school buildings or being in our school buildings, which we're still waiting for guidance on. And she also issued guidance on the size of crowds, particularly at high school athletic events, that are a percentage of square footage indoors and I have a number limit outdoors, and we'll disseminate that publicly once we have more guidance from the state of Michigan on it. Today, our teachers reported back to school, and we started to begin the process to phase back to in-person instruction through a hybrid. Our timeline moving forward, members of the board can see this and the community can see it. October 5th, students enrolled in categorical special education programs will attend half days. When we started to talk about phasing in, we talked about meeting our special population students and our earliest learners first, and we're staying true to that vision beginning October 5th. October 8th, we'll welcome our elementary students back for a half day by cohort, and you'll learn later on in this presentation why cohorting is so important and why cohorting in the manner that we're doing it is so important. It's important to also note that on October 8th and 9th, it's going to be critical that we work together to get our procedures, our protocols in place so our students and our staff are feeling very comfortable as we move forward. Remember, we haven't had students back in a school building since last March. And there's going to be a lot of social emotional support that we're going to need to work through. And our staff continues to do that as they began back in person at their buildings today, in addition to their normal teaching load in the remote environment. October 12th, we'll be welcoming all of our elementary and middle school students back for full day by cohort, and students enrolled in categorical special education programs such as ASD, cognitively impaired, SXI and EI will attend a full day. October 14th is a really important day for our high school seniors. The SAT that they missed last spring will be administered, and that is always an important test for college admissions. And October 19th, we'll be welcoming our high school students back again by cohort. We have a pretty aggressive timeline. There's a couple of reasons for this. One of them is we want to make sure that we have time to be able to get our students back through cohorts and making sure they're comfortable and that our staff can work through any glitches that may arise. And we also need to be cognizant of the fact that everything is subject to change. As I said earlier, there's nothing that's certain. We have good public health guidance now and things to consider, but as everyone that's viewing this and anyone that's not viewing it knows, there's nothing certain these days related to COVID-19 and as we move forward. So I hope that gives you an overview of our timeline of where we've been and where we're headed. What I'd like to do now is turn this over to Tanya Regmont, who has had a very busy weekend, not only working on this presentation with us, but also working with our community to support them with potential positive cases and making sure that people know what quarantine protocols are and where they can get support through public health. So Tanya, we really appreciate your hard work. Tanya is going to take us through not only what the public health guidance is and has been, but she's also going to take us through the flow charts that have been provided by the Oakland County Health Department, as well as some quarantining protocols. There's a lot of information tonight. And if there's any member of the public that needs help or support with it, I would ask that you contact your building principal. And of course, you can always contact us through the Talk to Us button or just simply give us a call. But there'll be a lot of information tonight. And this recording will also be available for the community as well. So Tanya, thank you for joining us. I'm going to turn it over to you.
Thank you so much for the introduction, Dr. Shaner. So in conjunction with the Michigan Department of Health and Human Services decision matrix in the current Oakland County Health Division weekly guidance report, school districts can make informed decisions related to school operations while utilizing current and local county data. So according to the Health Division, local public health conditions, the data affords RCS the opportunity to transition into a hybrid model, which meets the Health Division criteria by reducing density with strict mitigating measures. The Health Division makes public health decisions locally to ensure community safety. So this is an example of a weekly COVID-19 report that outlines the data that we will be utilizing. Right now, Cases per day per million remain flat. Our positivity rate over a 7-day average also remains flat and is trending downward. And death rates and hospitalizations are low. I'm ready for the next slide, please. This is also a summary which is available on the oakgov.com website, their dashboard that includes data and 7-day average of daily cases and death rates and trends cases by age groups. Ready for the next slide. So this is the Michigan Department of Health and Human Services matrix. And right now, in conjunction with the Oakland County Health Division report, which we are at a current county level risk determination letter C, it takes us into the high risk community spread category, which is how the determination is made for a hybrid model and considering the density. Also in conjunction with the positive cases that we do have in the district, in an attempt to mitigate the evidence of ongoing transition, which would keep us also in a hybrid space. So,
Tanya, can I just jump in here real quick, just for a little bit of context for the public and for the board?
sure.
This matrix that you see before you is from the Michigan Department of Health and Human Services. This matrix is also matriculated down through the Oakland County Health Department. The first rendition of this we received September 16th. We received a modified version of it that we'll show you in a minute on this past Thursday. We're really, to be honest, this is the information that we've been waiting for. If you've been on one of these board meetings before, you notice that I've expressed a fair amount of frustration with our inability to receive this, but we do have the guidance. The other thing to note for the board, and President Bull, you know this, and I just want to make sure it's in the public record. We're not sure whether this was supposed to have been publicly shared or not. I felt morally compelled to make sure that our citizens see it. And therefore, I'll accept responsibility for sharing this document, not only from the Michigan Department of Health and Human Services, but from the Oakland County Health Division and the two documents that we'll show you in a minute. Go ahead, Tanya, I'm sorry.
Oh, it's okay. Thank you for adding that information. And so by reducing student density and also implementing strict mitigating measures such as PPE, universal masking for our students DK through 12, and hygiene, spacing, movement, access in the cohorting, which is also a major mitigating measure that we can afford that opportunity with a hybrid model. So the communication, education, and reinforcement at home and school are also key to success in as a community taking personal and practical responsibility for containment of COVID-19 so that we can hopefully progress to the state of Michigan phase 5. All right, I'm ready for, so this is the Oakland County Health Division guidance that was derived from the Michigan Department of Health and Human Services matrix. So the the county level risk is actually C, which is equal to high risk. Again, we do have known positive confirmatory cases within our district. It also is determined by cases per million in positivity rates.
So this is the document that we received September 16th, and this is the document that we received this past week, September 24th. It's essentially the same document, but you'll notice that in C, because as Tanya said, we have active, you can go back to the other one, Lori, thank you, that we have active cases that are only really two options for instruction are to stay in a remote environment or to move to a hybrid, which the guidance allows us and says that we should do, considering reduced density. So that is what would be a hybrid. And we'll explain the notion of cohorting and why our cohorts are the way they are as we move on. It's actually a pretty intentional way to make sure that we can clearly contact trace. The better that we can contact trace and the better that we can follow cohorts, the less chance that we'll ever have to close a school building down due to infection and less instructional time that we'll miss. So that is deliberate and intentional in the way that we're cohorting and the way that we're planning on moving through buildings. And I know a number of the board members toured buildings to understand what the mitigation protocols were in place and what the building flow would be like, as well as the cleaning procedures. Go ahead, Tanya. Thank you.
Thank you. I'm ready for the next slide. So this is the interim health division and school district guidance. So like I just reported, our current status, we are in C, which is high risk. We have 47 cases per day per million population, 7-day average currently, and our positivity rate is 3.92%. So in determining this status, we use whichever category is higher. And so for school planning, the epidemiology risk is determined at the county level rather than the Michigan Economic Recovery Council labor shed region, as schools tend to draw pupils and staff from surrounding communities.
We just want to just kind of clarify that that number is determined by the Michigan Department of Health and Human Services, and again, matriculated through the Oakland County Health Department. We are, by advice of the Oakland County Health Department, using countywide data versus local zip code data, and that is due to the movement within our communities. The County Health Department really indicates that that's the safest way to dictate risk and then make decisions at a local level in terms of whether you're having in-person instruction, hybriding, or remote. So thank you.
Okay, so lots of questions about what do we need for full-time face-to-face instruction. So when we go back to the Michigan Department of Health and Human Services matrix in conjunction with the Oakland County Health Division guidance, where we need to be is letter B, which is medium risk, 20 to less than 40 COVID cases per million people in the county, or 7 to 10% positivity rate. Again, the category is based on whichever is higher. So decisions are made on science and data in collaboration with state and county health division guidance.
And Tanya, again, that determination on using the higher number, that is the guidance by the Michigan Department of Health and Human Services and the Oakland County Health Department.
Yes. So we did receive guidance from the Oakland County Health Division on a few different scenarios. To achieve viral containment, we need to we need to identify our positive cases, and persons need to either isolate or quarantine. We also need to quarantine close contacts, and we also need to manage persons that have positive symptoms of COVID-19. So this first flow chart is how to report a COVID-19 case at school. So a couple different things will happen. Potentially a parent or a staff member will call our COVID-19 team, which as per our preparedness and response plan, our COVID-19 designee is Elizabeth Davis, our Chief Human Resource Officer. And we will initiate steps on what to do if a student or staff member or any other individual associated with Rochester Community Schools has a positive confirmatory test. Or we could get a call from the Oakland County Health Division's communicable disease department any one of their epidemiologists to report that they know that there is a case associated with Rochester Community Schools as a result of contact tracing through their department. So decisions are made according to individual circumstances and a result of the case investigation. Case investigation opens upon receipt of a positive confirmatory test. I'm ready for the next slide. What do schools do when COVID symptoms appear at school with students or staff? So in this particular scenario, we will have protocols in place to isolate a student with supervision and to assess and see what needs are required at that time. We are recommending, as per Oakland County Health guidance, for the student to seek evaluation from their medical, their healthcare provider. And more than likely, the decision would be made and is encouraged to have a COVID-19 test. There are testing method parameters. We can only make clinical decisions based upon a molecular confirmatory test, which is also known as a PCR test. We can, in some cases, open an investigation with a rapid test. However, we cannot close a case without the negatory test. So what we're attempting to do is communicate with our community, our staff and our parents and our students is when they are seeking out testing, we really are encouraging the PCR test because we are potentially wasting time with rapid tests. And some urgent care facilities feel that the rapid test is just as accurate as a confirmatory test, but we cannot base clinical decisions on those results. And we cannot make absolutely any clinical decisions based on an antibody test. So we are recommending no antibody tests at this time. And on this flow chart, what do schools do when COVID-19 symptoms occur at school? There is the link to COVID-19 viral testing so that anyone can access the test methods. And these documents are made available on the oakgov.com website. What we are able to do now as of September 18th is if an individual has not tested for COVID-19, a couple things can occur. We can isolate the student or staff member, or we can accept a physician note if there's an alternative diagnosis, such as another acute illness, such as strep throat or flu, or if somebody has a chronic disease, such as allergies or asthma, that we want to limit disruption in school exclusions if the student or staff members' symptoms are part of allergies or asthma. And so what we really need to know is what are those baseline symptoms, because we can't have just a blanket excuse all school year for asthma-like or allergy-like or any other chronic illness symptoms. I'm ready for the next slide. So should I report to school? We definitely encourage everyone to report symptoms, positive cases, close contacts. So this algorithm gives us direction on where to go from there if a person who has tested positive or is waiting for a test result. And in most cases, if you are a close contact or you've tested positive or you have symptoms of COVID-19 and a negative test is not mandatory, However, in some of these scenarios, you may have to isolate according to the isolation period criteria, or quarantine according to that criteria. And so the difference between isolating and quarantining is a person who is infected will be given isolation direction, and a person who potentially came in contact or has symptoms would then have to quarantine. Each case would be evaluated on an individual basis, because there could be some unique circumstances related to an individual. So here are the close contact quarantine guidelines that I was referring to if you are a close contact. So a definition of a close contact isn't necessarily just coming into contact with an infected individual. There is criteria which this gives guidance. Mainly if you are within 6 feet of an infected individual for more than 15 minutes, or you are providing care at home to somebody who's been diagnosed with COVID-19, physical contact, sharing utensils, vaping, or somebody sneezed, coughed, or came into contact with someone's respiratory droplets. And so this is how we would determine based on a few scenarios, but again, each case may be unique depending on student, staff, or family circumstances. So we investigate each one individually. So what will the school day look like? This is guidance for our health screening process. So the Oakland County Health Division has provided us with requirements on student screening. So we have to have a parent school contract. This is a requirement by the Oakland County Health Division. They are requiring that the parent screens the student at home, and we will be providing guidance on how a parent will screen. The Oakland County Health Division's requirements are based off of CDC requirements about potentially limited effectiveness of screens at school, other barriers and limitations that could potentially cause harm. They do have in their FAQ on their website, oakgov.com, a full explanation as to why temperature checks and health screens should not be performed by school staff. And understand that it is a common widespread practice among business and community settings. So we were able to create a digital version of this parent health screening contract in Synergy, which parents and students can access through Parent View and Student View. This is a one-time contract at the beginning of the school year. And we also need to implement a daily screening protocol for parents to perform, which again, this is a paper version, but we were able to implement this into Synergy so that parents are able to complete the health screen prior to the student arriving on the bus or in the school building. There may be other screens that are required depending on school-sponsored events and activities that are governed through different licensing or professional organizations. For example, the high school sports, they're governed by a different body, so they require temperature checks and screening and are directed by the governor's office to follow that guidance. So if a student were to potentially go to school age care and per their licensing requirements, it'll again be based upon individual circumstances. This doesn't replace if a screening process if a student is suspect ill throughout the school day as well. So already talked about that. So it'll be incorporated into Synergy. This way we will be able to track student information, which will be helpful in monitoring any absenteeism that is unrelated to managing a communicable disease. So schedules, bus routes, teacher and school contact information, attendance, and much more. And will give parents a great opportunity and guardians to make sure that their contact information is most current and up to date. And it's also a secure way and confidential way for that information to be updated. Okay, and so when I talked about other governing entities, I just wanted to give an example of some of the protocols that we implemented. So middle school athletics, we did follow the Michigan High School Sports Association guidance, which then created a health screening protocol for these students to actively and safely engage in middle school sports. And also when carrying steps, there was a order to initiate universal face coverings. We decided to implement a FAQ, which was most appropriate for that program, to help transition into that new practice. I'm ready for the next. Oh.
So with regard to staff daily screening, like the student screening, all staff, contractors, visitors are subject to a health screening prior to entering district facilities. Currently, we have a QR code and a manual sign-in available for all staff, contractors, and visitors. And when someone answers yes to one of the questions, the Human Resources Department is notified of any positive responses, and all responses are investigated and protocols are followed with in accordance with the RCS COVID-19 Preparedness and Response Plan. The district is rolling out a new app called Clear2Go. It's a health screening app for staff, contractors, and visitors, which will replace the current process. The screening will take place by either the Clear2Go phone app or a link given to the employee or contractor by email or text reminder. The app will streamline our current process and allow for district case managers to monitor check-in activity, record, and contact trace using the system's record-keeping tools. It'll also provide us with an opportunity to monitor a building or department check-ins and screenings and zero in on possible close contacts and provide access to those who must obtain this important information. Thank you.
So last Friday, Governor Whitmer initiated Executive Order 2021-85. This requires all students in grades kindergarten and up in regions 1 through 5 to now wear face coverings in the classroom, whereas previous requirements exempted as a requirement face coverings in K through 5 classrooms as long as they were in their cohorts. So currently TK through 12, post-high, special ed, and all staff are required to wear face covering during the day and on buses. However, pre-K ages 4 and younger will not need to wear a face covering while in their cohorts If a staff or student does not have a face covering, we will be able to provide a disposable mask for them. So I wanted to talk a little bit about our expanded medical services that we have within Rochester Community Schools. So I'm Tanya Regiment. I am from Ascension Providence, Rochester, contracted full-time to Rochester Community Schools as the school nurse. We also have effective September 3rd as part of the Oakland County Health Division School Nurse Initiative. These nurses that have been instrumental in collaborating, and they are our liaisons to the health department, and it's really been a team effort in trying to implement protocols and procedures that will keep our staff and students safe as we transition back to school. So we have Jessica Hathaway, Suzanne Putman, Janae Tall, and Anna Whitaker. We also have a group of Rochester University senior nursing students that have also been an integral part in collaborating with our nurses. And within Rochester Community Schools, we have Susan Deminick, and she is a current administrator and former nurse. And then also Lori Grine, who is a former respiratory therapist, current administrator, and former hospital administrator. I'm ready for the next slide. And so with introducing our expanded medical personnel, in requirements of identifying isolation rooms for every school building, we have been tasked to separate well children from potentially sick children. We've had all sorts of different language being used for a space, a quarantine area, an isolation area, a sick room. So in collaboration with our newly expanded medical team, we came up with the idea of a care room so we can lessen any negativity that surrounds potentially falling ill during the school day. So CARE stands for COVID-19 Assessment, Respite, and Evaluation. So in every building, we will have that separate space for individuals with COVID-19 symptoms. We will assign a designated care provider, and we will also follow an isolation protocol. We will assess the needs of an ill individual who has symptoms of COVID-19. And if they are unstable medically, we will, as always, initiate emergency services by calling 911. We will allow a short period of rest while we contact their parent, guardian, or emergency contact. And Oakland County Health Division guidance is we need to send individuals home immediately. We will continue to monitor the student while they are in our care, and then initiate cleaning and disinfecting protocols upon student departure. So the isolation protocol and staff actions, we will be touring buildings starting on Tuesday. It'll be myself along with our Oakland County Health Division nurses, and we will review our isolation protocols as they align with their isolation checklist that we have not yet received prior to this date. So those protocols will be provided to staff during their professional development. The elementary building completion will take place this Tuesday, Wednesday, and Thursday, and then we will continue on with other buildings, middle school, high school, and ATPS. Our pre-K and our ECSE special education program will both follow the pre-K protocol that we've already implemented, And then special education programs will have unique considerations. And just a quick review about food allergy management and medical action plans. We are still asking our parents and guardians to submit their child's medical action plans or school health related forms. Food consumption will take place in a designated area outside of the classroom. And as always, provisions will be made for those students with special considerations.
Thank you, Tanya. We'd be happy to entertain any questions the board might have now.
Yeah, I think it would be, just to start out, I think it would be really helpful to go back to the slides. And I don't know if it was, I think it was like around slide 10 or 11 or 12, the ones with the ones that had the colored matrix with the grades on it. So yeah, like in this section here kind of. So just to start, I guess I just wanted to make sure I'm understanding this correctly. So our 7-day average case per day in Oakland County is 47 currently, and that's updated weekly, and it's and it has been flat. So that puts us in this category C, which is 40 to 70 cases per million per day average over 7 days, correct? Yes. And so, and then the percent positivity you said was, I think, 3.092, and that has been decreasing week over week.
Right, so the percent positivity is 3.92%.
Okay.
If there's the discrepancy between those numbers, then we use the higher risk level, which is the case per million.
Okay.
And that's the direction from MDHHS to use the higher number.
Okay, I just wanted to clarify that. What questions do board members have? Or Tanya or Beth or Dr. Shaner?
Yeah, I've got a question, and whoever would like to answer it. Yeah, I mean, processes and logic behind a lot of this stuff looks really good. You guys have done a hell of a job working on this thing. My question is less about process and things like that, but more about real life when it comes to the little people. You know, as much as I appreciate the governor's intent, good intentions to want to, you know, protect the kids and wearing masks in elementary, I mean, how realistic is it that we feel that, you know, little people, I'm seeing, you know, I'm thinking baby T, my daughter, run around, a little kindergartner or first grader, run around with a mask on all day. Like, you know, how are we going to kind of shape in that and work with those kids and those things? Because some of them are going to, you know, they're going to give you a little bit of trouble, and they're going to be a little bit sad. They might get upset. What kind of resources or ways of dealing with that have we thought about dealing with that kind of thing? Because I can really see that just being a real life thing that I know won't be necessarily the easiest thing in the world to handle.
Thank you, Scott. And I'm going to ask Debbie and Corey to chime in on this, but this is one of the reasons that we needed to bring the teachers back this week to not only practice the protocols in our buildings and make sure that we all understand what we need to do and to work out the kinks and use the capacity of our educators, but also to talk about protocols and procedures to get the routines down. Anyone that's been in an elementary school knows that routines are critically important, as well as expectations. And I'm just going to ask Corey and Debbie to chime in on that.
Yeah, thank you. And that's a great point. You know, there's a protocol on paper, and then there's execution in real life and learning and reflecting on it and seeing what's working well and what's not working well. You know, I draw back to, you know, our conversations in July as well, and the education that goes along with this, establishing these routines and the why behind. It's important for our students to have their masks on. I also feel there's a component, because we are in the situation where we need to reduce density. It does become more realistic to help manage that aspect in the class, because we're reducing the density in the classroom. And then it's also getting creative within the school day and finding times for safe mask breaks to take place for our kids, and finding ways for those to happen on top of the other mitigation factors that we have. So with the reduced density, social distancing does become something that's much more realistic and logistically feasible than what we were building towards in July without the seat time waiver. So if somebody were to have difficulty maintaining mask wearing, we can get that corrected while that person or individual is not within very close contact to another peer. But the education is going to be very important. Being patient with our kids and our staff as well is going to be very important as we navigate this.
Corey, will the students in elementary wear masks at recess?
There's opportunities for us to take mask breaks at recess, depending on the structure of that recess. So when we remain cohorting, guidance and benchmarking across other systems, when you remain cohorting, students can have masks off. When there's other opportunities for students to maintain space from one another, there's ways to have masks off as well. So that's what we're looking at. We want to make sure that we have opportunities for, for lack of a better term, for our students to have mask breaks in a safe and mitigating fashion.
Corey, I don't know if you can answer it from a secondary level as well. I know that I would need a mask break if I had a mask on for 7 hours a day. Is there some place for the older kids as well to step outside or, go someplace to be able to take that mask off for a minute or two?
Okay, Carrie, we were talking about this earlier today. Can you, you could touch base on it, and if Pasquale would like to jump in, that would be helpful.
Sure. Yeah, especially with given the length of the classes, we'll be looking at least 90 minutes in a class. I think if a teacher could take kids outside and spread them out and give them a mask break, let them take a deep breath of fresh air outside, nobody would have any problems with that. So as long as they're not, close together, and if we can get outside, especially, I think that could work. Pasquale, any other thoughts on that? Perhaps
Yeah.
PE classes?
Yeah, Carrie, we're talking as a secondary admin team about passing time possibilities as well. If we have 15 minutes to clean classrooms and we have opportunities for kids to go in certain areas that are structured, we're talking about those ideas as well.
Great.
Changing the subject and back to Tanya, what is the turnaround? Maybe you don't know this. I don't mean to put you on the spot. What is the turnaround right now for the PCR tests? Like, how long is it taking to get those tests back?
We are seeing, and I don't have a definitive answer, but we are seeing about a 48-hour turnaround time. Some of those delays that we were seeing have diminished unless the person got a rapid test first and then either had to go and get another test, meaning the molecular confirmatory. What we're finding in the limited data that we do have is that most urgent care facilities are convincing patients to receive the rapid test instead of the confirmatory test. And so we are working on educating our community on, discussing this with urgent care facilities, because those are the delays that we're currently seeing, that somebody received a rapid test and the specimen wasn't sent for a molecular study, and the person has to go back again to get tested either at the same facility or another testing facility. So those are the delays that we're currently seeing.
Thank you. That's helpful.
Are we asking our students, I guess, then, if they become symptomatic once we go back to school, to go to like Oakland County? I'm assuming that the tests that they're offering are the PCR ones.
So when we do get phone calls, prior to somebody already getting tested, then we are recommending them to call the Oakland County Health Division for a molecular PCR test. But a lot of times we are notified after the fact, and the student or the adult has already tested.
So the school nurse initiative that is coming through Oakland County, maybe you mentioned this and I might have missed it, but how often are they in the district? Are they specifically assigned to buildings? And if so, how long are they in a particular building? Like what's the schedule for that, for them being in the spaces?
So right now, the school nurse initiative is effective until the end of December. They started with us in September, and we have been working more so in a collaborative planning mode up until this point, which is why we will then be visiting buildings to make sure that their requirements are aligned with our protocols.
So, but they don't have there's no set schedule per se in terms of they'll be at, Brewster or Musson or Rochester. Okay.
No.
Okay. Thank you.
You're welcome.
I've got
Go ahead.
a couple more. I just wanted to confirm that based on the Michigan and Oakland County Health Department information, in order to go back full-time 5 days a week with everyone coming, not cohorting, we really need to hit that less than 40 cases per million.
That's correct.
Okay, so although we're talking about hopefully going back in mid-November, we need those numbers to come down in order to be able to do that.
We need those numbers to come down, and we need everyone to adhere to the strict mitigation protocols so we don't add to it, and hopefully help that number to come down.
And my other question, Tanya, was just if we could go back for a second. We were talking about that the students and any visitor staff have to do their screening before they come. And one of them is, do you have any of the symptoms, not including allergy or asthma related items? So for instance, like yesterday, there was something in the air that was making me sneeze and runny nose and, tickle in the throat, causing a cough. I would have marked that box that I had no symptoms though, because those were, in my opinion, allergic reactions. Now, what happens when they come to school? Because you were talking about that they needed some notes or, can you follow up a little bit on that?
Sure. So the physician excuse or medical provider note, there's a lot of different language referencing healthcare providers. And so a couple different scenarios can occur. So if you, just as an example, that around this time of year, you are going to wake up with symptoms of COVID-19, whether it's a mild sore throat, runny nose, but then maybe by mid-morning it resolves. If these are baseline symptoms of your allergies, you would obtain that doctor's note, and that would be on file with your respective school building. But we would need to know what those baseline symptoms are. If it's outside of your normal, then we have to consider another potential illness, which could be COVID-19, or it could be another respiratory illness. So if you didn't have a physician note on file already, and you woke up and thought, oh, you know what, I slept with my window open and it really feels like I have allergies, we would ask that you don't come to school and that you contact your doctor for further direction before you come in. And there a couple different things will happen. Your doctor, if you're it depends on that direction. That physician may want you to come in and be seen. They may want you to have a COVID-19 test. Each situation will be potentially unique. And so that's why we have been reaching out to parents with children that have chronic diseases that mirror one or many symptoms of COVID-19, that we have those that information in place. We could have a student that has asthma and is in an asthma exacerbation, but is also having worsening symptoms. that would be warranted to be seen by a medical provider and give us guidance, so that we're still in accordance with managing communicable disease, but we're not unintentionally excluding someone that shouldn't be excluded.
So I guess just for clarification, so you're saying like if I have allergies and I'm a student or a staff member, I need to right now I should be contacting my doctor and getting some form of a letter, and who am I sending that to, and how are we communicating that to our community? Because I have not seen or heard that. I mean, I would never have something on file for my allergies because it would just be something that I deal with whenever they pop up. And it's not something I would certainly want to go to the doctor for every time because that's not inexpensive. So what's the process?
So this is part of the work that we're completing with the Oakland County Health Division nurses. These, I just want to give you a point of reference that this guidance was not made available to us until September 18th. So we weren't able to implement or design what that process would look like. So that's part of our work that we're doing with the isolation rooms or the care rooms, and symptom management, as well as symptom management and communication.
I guess my question is, when is the communication going to go out so that people know they should be getting to their doctors, right away?
I'm hoping very soon. We are meeting at 9 a.m. tomorrow morning.
Kevin and then Mike, I saw you both had your hands raised.
Yeah, just real quick, and this is perfect timing, Tanya. There are some of our families who don't have a regular doctor. What other options? Is there can they go through an urgent care, or what would you recommend for options for those families?
We will be recommending at this point contacting the nurse on call at the Oakland County Health Division, just in the same capacity that we would do in other circumstances that children don't have, like you said, access or opportunity to a primary health care provider.
And Tanya, you're always available for questions with parents. I know we had a situation over the weekend in our community that you were available, and we can always people can always ask their building principal or contact Tanya directly.
Yes, I am always for the most part available to especially as we are able to roll out these protocols to give guidance to parents, to building principals, whomever may need help while we're navigating this process.
Thank you. I appreciate it.
Mike.
Thanks. So, Tanya, I have some contact tracing questions for you.
I love contact tracing.
Is everyone in the cohort then going to be considered a close contact? Suppose one kid gets sick.
That all depends on circumstance. So we investigate every single case, and we follow the close contact criteria that I had mentioned earlier. So potentially we could be isolating an individual, a few individuals, multiple individuals, classrooms, etc. So we're hoping that for example, parents will be transparent and let us know that their child was ill, and we can begin the investigation in collaboration with the Oakland County Health Division and minimize exposure while we're containing the virus.
Corey, can you just, on that note, can you share just a little bit of why the cohorting is so important and the nature of the way we did it, so we could really zero in on that contact tracing and hopefully prevent large-scale isolation or quarantining?
Yeah, thank you. So, as we research, and we'll talk more about the collaborative nature of how we got to the hybrid model that we're going to roll out. But in essence, our cohorts are going to come on consecutive days when you're assigned an A and B. And the reason why the team felt that was important is because it's going to give us a clean break before another cohort comes in. So to, Mr. Zabit's example of who is a close contact within a cohort, we would have time to investigate that thoroughly without impacting Group B per se, if it happened on a Monday. And it would give us time away for those individuals within that cohort as well. And for those that haven't come to us yet in a week. So if it's a Monday and somebody in cohort B is feeling symptomatic, or has answered yes to any of those questions, or somebody close to them, it gives time for number one, communication to take place between school and home. It gives time for home to ask the questions of medical professionals they need, as so many of these symptoms are related to other things and other things that that we've all felt at times. So by going with the consecutive days, we're giving ourselves a better shot of being able to figure out exactly who fits into that close contact without impacting the other cohort per se, at least within the school day.
And then, so I have a follow-up. So I guess for quarantining, is it 10 days or 14 days, right? I'm a little worried about that. Is there an alternative to it? Can you just get tested instead? And then if you test negative, then I'm okay. I don't have to quarantine anymore.
Again, it depends on circumstances, and our Oakland County Health Division nurses have been integral in helping us understand these processes. Isolation has its own criteria with being symptom-free plus improvement of symptoms in 10 days have passed. That's isolation. That is for an infected individual. Quarantining is to keep individuals from becoming infected, which is 14 days, which is also equal to the incubation period, which is 2 to 14 days. Individuals are considered contagious that are infected with COVID-19 48 hours prior to their onset of symptoms. And one of the challenges we're facing is most people are not having any symptoms. And so we have to base our isolation and quarantine status sometimes on dates of close contact and other factors. And so each case is not just a cut and dry, okay, you're out for this many days and this is your return. We also encourage the collaboration with the individual's healthcare provider, because what we're also seeing, and this is guidance from the Oakland County Health Division, is that persons can test too quick. So let's say, for example, you think that you were exposed to somebody with COVID-19 and you rush out to get a test, it may be false negative.
Yep. Okay.
So a key thing here that I think a key theme that we keep hitting on is communication. When you're in doubt, contact your building principal, contact Tanya, and we have systems set in place so we can quickly contact trace and set up a case investigation with the Oakland County Health Department. But we can't do it if we don't know about it. And I think that goes back to Michelle's point about medical conditions as well. And some of that's a judgment call, of course, right? In terms of how severe your cough is, whether you think it's your allergies. But it's really important that we communicate and have that conversation, have it with your building principal. If you need support of the school nurse, we're here for you. And I think the communication part of this is critically important.
Tanya, do you have a plan for people that refuse to wear masks?
Still trying to navigate through the executive order that was initiated on Friday, so that we can have a plan in place to implement some of those unique scenarios. It's something that we're working on, but not a solid plan as of yet. Would also like to collaborate with my nursing team tomorrow to see and respect what their guidance will be.
Okay, thanks.
And
What? Oh, sorry. Go ahead, Barb.
Sorry, Kristen, can you just reiterate again one more time why we're not taking the temperatures of students as they enter our facilities?
Yeah, sure. I could actually, if it would benefit the board, I can read the 2 paragraphs that are published by the Oakland County Health Division, which is also in accordance with State Department guidance and CDC. So health screenings refer to symptom screening, temperature screening, or a combination of both. Although temperature screening for COVID-19 has become a widespread practice in a variety of business and community settings, its limited effectiveness may be outweighed by potential harms. With respect to COVID-19, the CDC acknowledges that fever and symptom screening have proven to be relatively ineffective in identifying all infected individuals. This is because people with COVID-19 can infect others before they become ill, pre-symptomatic transmission. That's the contagious period that I had just talked about. Some people with COVID-19 never become ill, but can still infect others, which is the asymptomatic transmission, and fever may not be the first symptom to appear. There are also several drawbacks and limitations to temperature screening, including inaccurate results, potential risks to the personnel who are measuring temperatures, potential risks to screened populations, and significant logistical challenges and costs. Temperature screening may additionally lead to delays in the start of the school day and may also inadvertently increase risk of disease transmission if students congregate in long lines while waiting to be screened. For these reasons, Oakland County Health Division is not requiring schools to mandate temperature checks. Screening is not a requirement for schools. And so therefore, since it's not considered best practice, that's where the basis of the decision came from.
Okay, thank you for clarifying that.
You're welcome.
That was also my question. And to follow up on that, when I was on a meeting with other Oakland County board presidents last week, it was mentioned also that lining up and crowding to wait in line for a temperature check is also actually could be a problem. So that was one other point that they made. Mike,
and we don't want to provide a false sense of security either. We want to initiate interventions that are, effective and safe.
Thanks. Mike.
Yeah, going back to the matrix, I know Michelle said we had to get to below 40 cases per million per day in order to go to full in person, but actually we can be where we are today and have no cases in a building and be able to go full. If I'm reading this matrix correctly.
That is an option, Mike. And I would say this, and I want to remind folks of this, we haven't had kids in school in quite some time. And if that were the case where we could stand up more quickly to full face-to-face instruction, we would definitely consider that. But I do think we're taking a measured approach for 2 reasons. Number one, we have active cases and we really don't have an option at this point. And number 2, I think phasing up and making sure people understand the protocols and understand the importance of the cohorting and have all the training and the kids have the routines and our parents understand how important communication is will help us get to that point of full face-to-face instruction, hopefully more quickly and more safely.
Yep, I said that because I fully understand the reason we're going to the phase-in approach. I understand we need to take the time for everybody to get into it and tweak our procedures. I just wanted to point out that if when our staff and students are comfortable, and it looks like there aren't any cases in a particular building, we could do it.
That is true.
Thank you.
Kevin.
So just to that end, and revisiting Mike's question about wearing the masks, that makes wearing masks make even more sense, right? I mean, to get to where we all want to get, which is safely in person 100%. The numbers have to, at the minimum, as Mike's saying, stay where they are, ideally drop. And the best way for that to happen, Tanya, I'm surmising, is to wear masks, right?
And I think it's important to, sorry, Tanya, cut you off, but we think about it as a rules and an enforcement procedure. And I really, I don't, that's not where we need to be. Where we need to be is teaching our kids responsibility to take care of one another, teach them the routines, make sure they have appropriate mask breaks, make sure we're communicating with parents of why we're doing what we're doing. I think that is critically important, Kevin, but I also think it's critically important that, quite often we're rule followers, right? We want to find out what's going to happen if we don't follow the rules. Ideally, if we educate, if we influence, if we bring people to understanding our why, I'm hoping that people will take the steps necessary so we can get back to our vision of full face-to-face instruction when it's safe to do so.
Why are we looking at county data and not local Rochester Hills or our zip code data? And I'm asking this in part because it was asked in an email I saw it, I think yesterday or today, by a community member. And I think it's important to note that, we read all of these emails and we understand the concerns, and these are kind of the concerns that we're walking through right now. We're trying to get all of the questions out there that have been asked in the community. And I know that's one of them. And I don't know who the best person is to explain that. If it's you, Dr. Shaner, if it's Tanya, maybe it's Mike Zabit. I don't know, someone who's smarter than I am in mapping and data.
Well, the group's always smarter than the individual, at least in my case. But I'll take a little bit of a stab at it, and then I'd like Tanya to kind of support it. So first and foremost, it's the advice of the Michigan Department of Health and Human Services and the Oakland County Health Department as our local public health experts that we pay attention to the countywide data to make local decisions. My understanding as part of that is once you get very granular in the zip codes, it adds variance to the data. But I also believe that we have an issue where people travel, right? So you might work in Holly, but you might live in Rochester Hills, and if you're diagnosed, it's a Rochester Hills case, even though you're spending a majority of your time maybe in Holly, Michigan. So it's a little bit of a misnomer that it's a zip code issue. But one of the things that we're so lucky to have in our Board of Education is people with some expertise sometimes that can help us model these things out. And if Mike, you could just really talk a little bit about what we've worked on in terms of modeling and risk assessment, and then maybe Tanya can wrap it up. I would really appreciate it, Mike.
Yeah, so I've developed this risk model and shown it to Dr. Shaner and Cabinet as far as the risk per school level and per age group, right? And when we kind of understand all the pushes and pulls that will reduce the amount of risk to the individual to a level that's right about the level of the flu, okay, for infection and hospitalization and mortality. We are comfortable bringing our kids back into the building if we can get those levels, the risk levels, down to the level of the flu. And we think we can get there with all of these mitigations. Now, part of that model is using the county level data, the infection rates, because that's basically the probability that you'll be in contact with someone who's actually infectious. And I know that question came up in the community because, I think it's 48909 is like at 187 cases per million. But there's, I think, less than 100,000 people in that zip code. So you're getting into a rule of small numbers here. And the number, as Dr. Shaner said, is going to be very variable. It's just like looking at our enrollment predictions, right? You can predict enrollments for the very large bodies, but when you get down to individual schools, it's very hard because the variation is just too high. And so I think at this point in time, the data is just not good enough to go down to the zip code level. You want to stay at the county level, and you know what, the county health division is also looking at those numbers, and I'm sure they noticed the discrepancy. And I think, you know, Dr. Shaner can continue to work with them. At some point, they might say, okay, you guys, your numbers are just way too high compared to the county level. We're gonna make you use the local level. I don't know, right? So that's up to them. That's up to the health experts.
I would have to agree that these decisions are assessed by the epidemiologists and the team within the communicable disease department at Oakland County Health Division.
Any other questions from the board related to the health protocols or the data information? Andrea?
Yeah, I know we're spending a lot of time on this, but just two things from two very probably two very different viewpoints. So on the one side, you know, we're doing all of this for statistically what is showing, you know, our children's death rate from this virus, and it's a horrible thing to even have to talk about, is very, very low. The percentages are very, very low. So on the one side, can you talk a little bit about why go through all these hoops to get back and not be back full time with such a low rate in children? On the exact other side, can you talk a little bit to why go back now? You know, can we safely do that, and why not stay remote longer? So I'd really like to hear just kind of both sides of the coin, probably from you, Tanya. Oh, you're on mute.
Goodness. Sorry about that. So as we continue to follow the data from the Oakland County Health Division and guidance from the State Department, we haven't had, you know, the opportunity to, you know, decide about, you know, low death rates in children. We are part of a community. And so even though right now our children, you know, potentially have low infection rates and death rates, we also have to think of our other age groups and our most vulnerable populations as a community as a whole. So the State Department updated their requirements for managing communicable diseases in school. And we are also under the jurisdiction of the Oakland County Health Division, and they make decisions at the local level with regards to how to manage communicable diseases. And so that is, we're following their guidance with the true and factual data that we have available to us at this date.
Yeah, I would add to that, Andrea, if it's okay, that again, you know, the reason we began down the road of phasing up is a couple of reasons. First of all, Tanya mentioned the data and the guidance that we're getting from the health department is found me in a place that we're more confident. I think the modeling procedures, the modeling exercise we went through with Mike helped us to understand and continue to understand as we thought about it. We always talked about this for a while. We wanted to be able to make sure that we mitigated risk. We knew we couldn't prevent risks, and we certainly didn't want to put ourselves in a position to add to risk, not only to our youngsters, but to our adults as well. As you know, this is a novel virus, and we have to be cognizant of the fact that our youngsters may not be getting sick at a rate that maybe our adults are, but we've got to keep everybody safe. In terms of tolerance for risk and the need of our community, I think as we and some of our educators might be able to speak to this later on, as I traveled this school district, as I traveled and talked to parents, it became also something to reflect and think about in terms of the need that some of our special populations and our earliest learners we're really would benefit from being an in-person instruction if we could mitigate risk and not add to it. And we really feel like we're at that point. And I think it's really, really important. We can't say this enough. You know, this is a point in time we're having a conversation tonight. Things are changing rapidly. I know we all like certainty, but I'm here to tell you that we can't be certain that we'll be back to full face-to-face instruction in mid-November. Maybe we'll all get lucky and it'll happen in 2 weeks. Maybe it'll be after Thanksgiving. Maybe it'll be like it was after 4th of July when we thought we were going to be in phase 5 and we're still not. I think it's important for us to continue to plan. It's important for us to continue to communicate on this. And I think it's critically important for us to continue to assess not only our risk mitigation, but also the needs of our students, particularly our special populations and our youngest learners, and those of us that have seniors and juniors that are thinking of heading off to college and need that face-to-face instruction. We are not eliminating risk, we are mitigating it, and we feel confident right now that we're not adding to it. So we feel like it's a good time to phase up and start to get ready to move back to face-to-face instruction.
All right, thank you. And you know, I think this probably could be asked later, but I'd like to ask it now in the sense of health, because I do think that's probably one of the most important factors in this. So let's say I'm enrolled in remote school and it's working. And my student is really, I'm not comfortable with them going back. What do I do? You know, what do our parents do if they're not comfortable and ready to go back part-time? And you know, what is their option? Would they be able to move to the virtual academy? You know, do we have any thoughts now as to what they would do?
Yeah, one of the things that I think that we've learned through COVID is how individualized education is, and particularly with public health, it makes it even more individualized. Mm-hmm. So the first thing I would say is those of you that have some risk factors or may have a child that has some risk factors or a unique circumstance, communication is important here. I'd ask you to reach out to your building principals and have that conversation. You know, we might be able to educate you and feel better about sending your child back to school and that it's safe. We may find out that your circumstance is such that we're going to have to make some accommodations, and we certainly will do that. In terms of moving folks to the virtual academy, again, I would ask that you contact your building principal or one of us administrators, and we'll talk through that circumstance. If we can accommodate folks, we certainly will. But I think it's important that people consider their own personal risk factors and the risk factors in their home. In the context of what we're sharing here tonight too, in terms of what we're doing for mitigation and what we're doing not to add to risk and to be able to give kids that one-on-one instruction in hopefully a cohort that's very traceable and very safe.
Bob, since Andrea asked that question, I mean, just to follow up, if people felt that the virtual did not fit their child's, learning ability, and they're not comfortable going back, is there another option for them within the Rochester schools?
Yeah, one of the things that we've talked about again, and I think it's the first step is to contact your building principal and have that communication. The second step is for us to figure out what kind of accommodations we might be able to put in place. And one of the things that we're also as we talk through leaves with our colleagues and who physically can't be at work because of their risk factors, we're looking at opportunities for them to help support that situation as well. But I think the first step is for us to ascertain what the magnitude of that need is. So I would ask again that folks would contact their principals and have that individual conversation and what those risk factors are, or what the circumstances and how we can accommodate them. We certainly want to do that, and I believe we are well positioned to do it.
Thanks. I think if there are no further questions about this first section of the presentation, we can move on to next up. We have operations and facilities. And I'm not sure who's taken on that one.
Hey, good evening, everybody. Thank you for the opportunity to provide an update on our operations. As I believe everyone is aware, we are required to meet the mandates of many different entities, including the governor's return to learn plan and mandates from the Oakland County Health Division. Tonight, we have several members of our operations and instructional teams here to report. I'd like to start off with Makai McCollum, our contracts manager, to give an update on PPE and cleaning.
Thank you, Matt. Good evening, ladies and gentlemen. So beginning in March, we basically started ordering gloves, masks for adults and children, as well as gowns and face shields. We just recently ordered and received some of the clear face masks for our speech pathologists, as well as humanity shields. We're also ordering head coverings. These are in all the buildings and schools. Let's see. Okay. Some other items as far as cleaning and sanitation goes, we also ordered and received for one of our buildings a sanitizing machine, as well as the handheld electrostatic sprayers for our buses. We have through our suppliers orders that are coming in. So getting the supplies and being prepared for school will not be an issue. Staffing levels. We did do specific training to COVID and post-COVID pandemic cleaning. We've established protocols basically to start cleaning every 4 hours in accordance with the governor's mandate. We obviously go above and beyond that at carrying steps. Let's see. The lead time for supply deliveries. Well, back in March, we ordered some stuff that took until July, but that's sped up with a lot of companies coming on board and offering some of the PPE. So it's gone from 3 months to 3 weeks, and in some cases, just a few days. Supply distribution and safekeeping. We have supplies located at every single one of our buildings on shelves, as well as in the classrooms and in the front offices. We also have enough on hand to get us through the first 2 months for most of our supplies, as far as masks and gloves go. As far as additional costs, we have seen a lot of additional costs as far as ordering all this PPE, a lot more than we would typically use in a school year. I think right now it's double. And one of the things I manage is the supplies for the buildings, just like soap and paper products, etc. With the additional PPE and supplies as far as hand sanitizer and that sort of thing, it's basically doubled as far as what we're paying. As far as safekeeping, everything's secured. Face shields, gloves, those are for the teachers and the staff. Those are maintained in a front office of the building administrator, and everything else is secured where our custodial supplies are kept. As far as distribution, right now, because a lot of these things were ordered bulk, not through the main supply chain that we used, we had them brought to a central location, and then they were distributed by myself and a few of the other account managers. However, moving forward, everything's going to be going through our normal supply chain and will be delivered to each building as we use the equipment and supplies. As far as the cleaning model, the custodial staff schedule to basically get everything done that is required for phase 4. We brought our second shift that normally started at 2:30 p.m. They will now start at 11 a.m. or before that. That gives us from the 8 a.m. Mark to 4 hours of students in the building to start the high touch areas and bathrooms and main areas as far as the cleaning and sanitizing. As far as student schedules, not as far as I'm concerned with that, not much has changed other than there is a time for everybody to be out of the building. So we don't have rentals in the building, so that will definitely help out as far as getting everything clean. And everyone's pretty much going to be out by 4:30 for the most part, and that'll allow the custodial staff to get everything clean where it's supposed to be. As far as a collaborative approach and what's necessary to meet the cleaning requirements, we've already been executing this and we'll adjust as needed. But currently, with our current labor, I believe we're going to be able to do it. PPE, face shields, masks, and gloves. Those are supplied to the staff. We do have also on-hand disposable masks for students and for child-sized masks. There has been training, but training is continuous as we get new employees on how to use the chemicals and safely handle all the equipment, as well as storing and keeping our supplies and products secured and away from where they could be dangerous. And then as far as cleaning products and supplies at each classroom, we have, in addition to what was already there, which was soap and paper towels, we've put hand sanitizer as far as disinfectant wipes in every classroom. We've also implemented a cleaning checklist. This is very similar to what has been required in hospitals and a lot of times at restaurants. And as things are checked and filled, these will be initialed and checked off every 4 hours. As far as limiting the use of school sites and facility cleaning, those areas that are not used and the areas in the building that are not used, those will basically be marked off and not necessarily be clean if no one's going into them. And that'll also give us more labor to focus on the areas that have been used and are being occupied. So students and staff, we talked about that, leaving within 1 hour after the school day ends. That basically allows for that deep cleaning to take place without any distractions. And again, rentals, typically there's a lot of rentals that start at 6 p.m. and go to as late as 9:30. With those programs ending, those spaces will not need to be cleaned. So again, that gives us that labor to focus on where the students and staff are in the building.
Okay, I'll take this one. Thanks, Micaiah. One of the areas of interest as it relates to COVID-19 pertains to indoor air quality. It's become a big issue. So this is a list of some of the items that our facilities group is working on to address indoor air quality in our buildings. So we've increased the amount of inspections and filter changes in our equipment. So currently we're changing filters three times a year. In the district, we have about 4,000 filters, so it's almost a person full-time year-round to change filters. So by the time it gets done changing the filters throughout the whole district, it's time to start back up on them again. So it's a big effort to do that. We're also increasing the run time for the equipment to run. So typically we used to start up the equipment about an hour before people would arrive in the buildings, and then we'd run it about an hour after a custodial was done securing the building. So now we've increased that to 2 hours before and after the building's closed. So we have more air circulation going through the building. We're also increasing the amount of fresh air we're bringing into the buildings. We're able to increase it. Current code requires 20% outdoor air, so we're going to increase that to 25 to bring in some more fresh air during the day, so we get some additional fresh air brought into the building. And then also we're working with the vendor. We're looking at double checking the balancing of our air handling equipment to make sure it's producing the proper amount of air that's required by code. So we're double checking all those quantities right now. The good thing is most of the space that's been renovated through the bond program, we've double checked and adjusted all the air flows so they do meet code requirements. So we're just going back through and looking at all the areas that were not touched by the bond to make sure we got proper airflow through the buildings.
I don't know that we have a slide for this, but could you give an update on the status of the building signage that's going to replace the temporary signage that we have in place in response to our COVID preparedness plan?
Sure. We're working with a vendor. We have a vendor on board right now to provide all the COVID related signage in the building. So currently we're going on a walkthrough, just double checking and marking where all the signage goes. For each building, we've created a signage plan to provide all the various signs. So in a typical elementary school, there's at least about 90 signs that are required. Each building principals and sent a plan layout of their building, so they have a layout of where all the signage goes. So as we get the signage in place over the next coming weeks, we'll be able to get some feedback from the buildings to see if we have to, alter that or add some additional signage that we didn't anticipate when we first did the first walkthroughs.
Thank you, Pete. I think we will pass over to Dennis Markham, our transportation consultant.
Good evening, everyone. Thank you for this opportunity to speak to you. I'd like to discuss some of the plan that we have for riding the bus and how we're going to try to keep everyone safe, including the students and the driver. The drivers will be wearing a face mask anytime they're loading or unloading the students, or anytime they might have to stand and address or talk to the students. There may be times when they're driving that the face mask, if it fogs up their glasses or it becomes unsafe for them to continue wearing the mask during driving, maybe it's an obstruction, that they can pull the mask below their chin while they drive. They're going to try to keep the first seats on both sides of the bus empty to increase the social distancing space between the drivers and the students. The drivers are going to wear PPE while sanitizing high-touch surfaces between each run. So after they deliver the first group of children to school and the buses are empty, they're going to put on gloves and masks and a shield while they wipe the high-touch areas, including the handrails and maybe the seats, before they begin the next run, the tops of the seats. And again, no students will be on the bus anytime there is cleaning or sanitizing being performed. Every bus will later be cleaned with electrostatic wands after the morning and afternoon runs. All cleaning and sanitizing will be documented by the driver to ensure consistency and to show that they've done that after each time that the bus is cleaned. There will be teams that we're going to use for cleaning those buses with the electrostatic wands after the morning runs and again after the evening runs. And they will enter each bus, and it only takes a couple of minutes for them to use those wands to clean completely the interior of the bus and document that they've cleaned the bus and it's ready for the next run. The drivers will adjust windows and roof hatches when possible until it gets too cold, and still they'll be able to open some of the windows and perhaps even the roof hatches to ensure that there's going to be adequate ventilation going through the bus. Each time the student comes to the bus stop and enters the bus, there's a bottle of hand sanitizer that's been mounted low on the bus just inside the door that each student can reach. Even the smallest of our students will be able to reach the hand sanitizer and clean their hands. Each student will be required to wear a facial covering or a mask. And if they forget a mask, the students will be provided with one, and no one's going to be turned away anytime for not having a mask with them. Transportation will be available for all eligible students. Students will be assigned a seat to facilitate physical distancing. The plan is to put families together so they're seated together and group the students by their bus stop. So in the afternoon, as they get to the bus stop, we'll be unloading from front to the back of the bus. Once in the morning, the buses arrive at the school, the drivers are going to systematically dismiss students one row at a time, one side then the other, from the front to the back. This will reduce the amount of time students have to walk past other students, and it'll help the staff at the school to not have the onslaught of kids all running out the door at the same time and running into the building at the same time. So it'll slow things down a little bit. And again, at the end of the day, I just mentioned that the buses will unload from the front to the back, and then there will be cleaning again at the end of the run.
Thank you, Dennis. Next up is Tracy Heiser, our Director of Dining Services.
Thank you, Matt. So tonight I'm going to talk to you about our cafeteria models. The USDA passed a nationwide waiver on August 31st, which allows all students to receive breakfast and lunch meals free of charge. This program will be in effect until federal funds have been exhausted or by December 31st. In the beginning, we will offer prepackaged cold meals in the cafeterias when we start a full day back in session. And then we will eventually transition into hot meals, but we'd like to get our process down first before we start to roll out the hot meals. All cafeteria staff will practice social distancing, and they will be wearing the proper PPE at all times. We have installed plexiglass barriers on all of our service lines and around our cashier stands. I'm not sure all schools have been completed, but I have been told October 2nd, all of those will be in place. We do have a social distance signage installed at all the buildings in these service areas. We will not have to use the POS system, the point of sale or the cash register when we go back to school, because all students will be free of charge, and we will not be selling any a la carte items or anything that the children would grab on their own in the beginning. So we will only be using a tally sheet to record the amount of meals we serve that day. Students will be released on a staggered schedule when they come down to the cafeteria to receive their meals. And I know the district is talking about considering adding extra lunch line to the secondary schools, which would give more time for the students and less children in an area when they're eating their lunches.
All right, thank you. I think we have Dave Pontius, Josh Winkle, and Lisa Fosnow.
Thank you, Matt. Good evening. We want to thank the Board of Education and the RCS administration team for allowing us to join you this evening. As we discussed earlier in the timeline at the beginning of the presentation, the work on our RCS response plan has been ongoing since March. Our subcommittee groups focusing on in-person instruction worked diligently throughout the last 6 months to brainstorm and collaborate on plans and procedures for a return to the classroom. When the governor's roadmap was released in the middle of the summer, we received further clarification on the requirements all schools would need to meet in order to ensure a safe learning environment for staff and students. Over the past month, building level groups and other teams across the district have worked to analyze the recommendations of both the governor and our subcommittee groups in order to outline a complexities chart of completed, incomplete, and ongoing tasks required for in-person instruction to take place. There are many details within this plan for in-person learning, ranging from things like how students exit a bus, as Dennis talked about, to managing staggered passing times, and even to how students are seated in the lunchroom. All these protocols and details are designed intentionally for the purpose of mitigating the risk of exposure and allowing contact tracing in the event a case arises. The subsequent building level plan also creates coherence across all RCS district facilities. I'd now like to introduce Lisa Fosnow, my colleague and principal of West Middle School, to talk about some of the complexities within each building and our plan for preparation. Lisa?
Thank you, Josh. So as Josh mentioned, it was really time for us to drill down to the details after our first plan was established in July and presented to the board. In August and September, the team's work included evaluating each individual goal on the roadmap by level groups. So what we've done is we got together as elementary, middle school, high school, along with our Schultz campus programs and our operational teams. So the feedback from each group was documented and translated into individual action steps. Each of these action steps we summarized into a building principles checklist, along with the intention of clarifying these cohesive goals for all building leaders across RCS. Our goal in creating this document was to ensure unity across the district and preparedness for bringing our kids back into our buildings. As they say in chaotic times, sometimes simplicity gets you back on track to accomplish the goals you set forth. So this checklist is straightforward for that exact purpose. It helps us to accomplish this goal of returning to in-person learning. So next, I am going to turn it over to Dave Pontius, principal of McGregor Elementary, to talk a little bit more about the preparation plan using the building principles checklist.
Thank you, Ms. Fosna. As you can see, we took a very complex matter and boiled it down to very, I don't want to say simple, but one that creates clarity and reinforces clarity throughout the entire organization. We developed this principles checklist, and within the principles checklist, there are live links where principals can go right to that link and have the resources that they need to clearly communicate to their staffs and communities of how we are going to mitigate risk for when students and staff return. This has been a long time coming together. As Mr. Wrinkle and Ms. Fosna had described, we had a huge complexity of over 100 people coming together, and it boiled down to this document, simple, but yet very clear document, somewhat like our strategic plan from a few years back. So once again, that we communicate clarity and reinforce that clarity. If we could go to the next slide, please. At this point, I'd like to introduce Ms. C.A.R.E. Lawler and Mr. Corey Heitch to talk about our instruction and our return to learn plan.
Thank you, Dave. Dr. Shaner, at this time, did we want to pause for some questions for the board after that section?
Let's pause for a second if we can, just on this section to get some questions from board members. My first question is for, so those checklists, are those going to be made public, or even a summary? Is that something that our parents can access to learn more information if they are wanting to know about exactly more about protocols in their schools?
Yeah, so Dave, Lori, those are live links on this document right now, correct? We'll make sure that they are also.
That is correct.
Yeah, and we're also make sure that they're available on our website. Dave, can you just talk a little bit about what the checklists are and where people might see them?
Yeah, absolutely. So for example, one of the checklists that we've first distributed was to building principles. So what would happen in this, and one of those is the classroom checklist. So staff, building principals, designees within the building have been going in the classrooms to make sure, for example, that each classroom has specific items to help mitigate risk. Those things are hand sanitizer, extra face masks. Each teacher receives a face shield. And then we also go through the classroom to make sure that desks are physically spaced, facing one direction, and that cloth furniture, as much as possible, is removed from each of those classrooms. That would be one example. The next example would be a cleaning checklist for our custodial staff. Those checklists will be posted in the classroom, and they will be checked daily. Staff will come around, collect those checklists to ensure that each room is properly cleaned daily. So those are a few examples of what's on that checklist.
I was wondering if someone could speak specifically, maybe Corey, it's you. I'm not sure if Kelly Desi is in our Zoom right now, but some of our board members, I was able to tour Brewster with Mrs. Desi on Friday, and I was really blown away by the classroom the way the classrooms are now organized. So the classrooms have essentially been recreated to accommodate the cohort, and I think someone else here will be able to describe that for our families better than I did. I wish I had pictures or something, but I don't know, Corey or Debbie, or can someone speak to that and describe that?
Yeah, I'll go ahead and kick it off, and then I'll defer to the group as well. Dave, building principals, and we happen to have a couple teachers with us that we're going to introduce in a little bit, if they wanted to chime in and say just how their environment has transformed at the elementary level or the middle school level. So the biggest thing, and I'll speak personally, is physically walking in and seeing what we typically view as a very collaborative space that reminds us of those pictures that we've seen in our social studies books with rows and everybody facing the same way. It's shocking to see. It's stunning to see, because we have not seen rooms set up in that manner in years, and we've actively worked have our classrooms become more collaborative spaces and to build more peer relationships and interpersonal skills. But I'll turn it over to Dave. He's done some work on this and his team at McGregor, and also if the other principals want to talk from their perspective on what they see within a classroom setup.
Thank you, Mr. Heitch. Back in late July, I was asked to help put a team together, and we had some teachers come together. One would be Miss Sarah Davis, who's joining us tonight. Sarah, if you want to wave so everyone can see you. Miss Sarah Davis, another second grade teacher from McGregor, who is now in the virtual learning campus, and a specialist teacher, Miss Laura Klein. We asked them to look at the classroom and help design a classroom that would help promote learning as much as possible, while at the same time mitigating risk to individuals. And we are creating a story specifically. Lisa, you want to jump in? Because we're kind of making it our own at McGregor about this one student and 615 and contact tracing. And we're creating this story to help create coherence and clarity. And that started with RCS teachers creating a classroom that not only promotes learning, but mitigates risk.
Maybe you guys could just talk about some of the things you've had to eliminate in classrooms in terms of the cloth furniture and things like that as well.
I think to go along with what Mr. Pontiff was saying, we've taken our cafeterias too. Cafeterias look different they did before. So we're also creating as a district a student video that will be coming out in the next couple of weeks. And the point of this video is to give some kids exposure to what the environment is going to look like, because there are some drastic changes and it's going to come as a surprise for students to see hallways labeled directionally. Cafeterias are spaced apart and distant seating so that students, when they remove their masks to eat, are going to be 6 feet apart from one another. And again, these are all protocols to mitigate risk of exposure. So we wanted to give them a little glance at what that environment would look like before they set foot into the building so they can prepare for those changes.
And thank you, Lisa. And Kelly Dessy is actually here as an attendee tonight. So Kelly, if you want to unmute yourself, I believe you can do that. If not, we can help you and just share a little bit about your tour and what you were able to show as folks visited Brewster on Friday.
Hi, Kelly. I didn't mean to put you on the spot.
No worries. We're here to help, and I appreciate the comment. And yes, we're all working very hard collaboratively, and we certainly want our kids to recognize the joy that's in their elementary buildings, but also we are doing everything possible to make sure that we're mitigating the risk. So yes, the teachers have been working well together as far as looking at the setup of their classrooms and looking at a cohort A and B and organizing desks, as Lisa was saying, all facing the same direction and making sure that we're using the spacing as safely as possible. It surely has been an opportunity to have all of our team members get multiple eyes on these rooms and make sure that they're welcoming for kids, but as safe as possible. So those soft items are out and hard surfaces are there for us to easily clean. And we look at traffic patterns and look at the way our students will move in their classroom. We're looking at how we're organizing materials ahead of time to make sure that kids have their own independent items. And so all the collaboration from elementary all the way to secondary has been phenomenal. So thank you for sharing that you were interested to see how it looks.
To show the level of collaboration that's occurring, Ms. Cunningham or Ms. Davis, would you like to show exactly what Ms. Dessy talked about? A picture's worth 1,000 words.
Sure. If you don't mind, we're going to go on a little tour of my 3rd grade classroom. Mr. Beers, it looks a little familiar to you because your son was here not too long ago. So I'm going to try and set this up so you guys can see it. Students are separated in 2 groups. There will obviously be one for cohort A and one for cohort B. On the side of their desk, you will see a little magnet that holds a tiny little hand sanitizer. So they're all personalized to students. On their desk, don't mind me as I become a third grader here, there is a tiny tub that will be seated at their desk, which is a personal trash can that they will deal with at the end of every day. That way we kind of decrease that movement around the classroom. Inside their desks, you will notice a piece of blue tape. On this side is personal items like crayons, pencils, anything like that. And each student has their own set of Kleenex. On the other side will be all of their other belongings. Obviously, this is a third grade setup. All desks are facing forward. Students who receive additional support and services have an empty desk next to them. That way, if somebody is supporting them one-on-one, they can sit there and have any additional materials that they need in that empty desk.
Also, too, one of the things that we've done is we've worked together collaboratively to create some PPE within the building to help students collaborate in some instances, and we'll continue to do that.
Thank you so much for letting us put you on the spot. I really appreciate that. I wanted to say that, and I'm glad you showed that, because one thing that I wanted to make clear that my number one observation when I was in the classroom was it wasn't like static and impersonal to me. And that is what my gut reaction was when I was driving there, was this, like, I guess I had a preconceived notion of what a classroom right now might look like. And it was really the opposite, because I could tell so much care and thought went into every single aspect of how those classrooms look right now. And it's something that I think it will be great if we can, if parents are at all concerned, or if parents want to, on a case-by-case basis, I hope it's okay that I say this to all the building principals. I hope it's okay that I say this on a case-by-case basis, if they want to come visit the school and see and just feel a little bit better about the situation. I know we're talking about doing videos and maybe virtual tours, or but that was my number one observation when I went into the classroom, was just how actually like personal it seemed, how organized it seemed, and how it really seemed like a lot of care went into it. And I feel like the kids will feel that, and the parents too.
Thank you so much, Mrs. Bull, for saying that. And really, truly, we are putting so much thought into it, because we want our kids to not only feel safe, but feel loved in that space. And we know it looks different, and they haven't been in school since March, but it is our first and our priority to make sure that they're comfortable and they're in a learning environment that's engaging and they feel loved in. So thank you for that so much.
What questions do we have, board members? Michelle.
I had a couple questions for Micaiah, if he's still here. I wondered if you could, we've had questions and people commenting on the, what are they called? The 360 machines, like what we're cleaning with. Could you just talk a little bit about when those would be used, and that's maybe when kids have gone home, and how quickly it dries, and the safety of that?
Yes, ma'am. So that's a great question. And that's a lot of the questions that we've had. People are alarmed when they hear Clorox 360, because they think that we're spraying chlorine gas, in, which is not the case, because Clorox obviously makes a lot of bleach. So there's a disinfectant that's electrostatic charged. No one other than the person using the machine should be in the room. They're wearing PPE. They're wearing the N95 mask. They're wearing also gloves and a face shield. Everything is clean prior to them coming in the room, as it normally would. And that's just another additional measure that they do. It's safe to enter the room and breathe normally 30 minutes after it's been used. However, it's gonna be the last thing done at the end of the evening. So there's at least 12 hours before anybody should be back in that space. So it's completely safe. These machines are nothing new. They're used daily and routinely in hospitals. So that's basically what it does. And then to speak on the chemical, it dissipates. It doesn't leave a residue. It's not harmful to touch the surface once it's been sprayed. I hope that answers your question.
Thank you. I had one other for you as well. In regard to the rentals, I understand that it makes it much easier that we've suspended rentals. I also know that it's a loss of revenue to not have those, and it may be some ill will in the community because we're not allowing that space. And I wondered when we're going to be revisiting that to look at when we might be opening it back up again.
I'll take this one, Micaiah. It might be easier for me. So we have been contacted by a few community members, particularly about our pools. We are reevaluating it as we speak. One of the concerns that we have is the additional cleaning costs and also the resources in terms of making sure we get our classrooms cleaned. So our first priority is really to focus and make sure we can get those cleaning protocols exercised in classrooms, and we have very clean instructional spaces. And our next tier will be to open our rentals back up.
And I would assume too that we can look at that additional expense if that is associated with it and renegotiate a contract potentially for them to bear some of that cost.
Absolutely, it's something that we've discussed. Appreciate you bringing it up. Thank you.
I just wanted to ask, and I'm making this assumption, but some of the monies that we have gotten from the state in terms of how it came down from the federal level for the C.A.R.E Act, obviously hearing Micah talk about the mitigation procedures for cleanliness and what's involved for that and having the PPE, there's obviously costs associated with that. So I don't know if Matt wants to kind of, I hate to put you on the spot here, Matt, but, just maybe briefly talk about the additional costs that, we're looking at as a district in order to implement these cleaning and mitigation procedures as we phase in back to in-person learning.
Sure, yeah, there's not only costs associated with the PPE and the cleaning, but the creation of the virtual campus, offering that option for our families cost over $1 million plus the teachers that are currently staffing those classes now. PPE looks to range to at least $1 million, depending on how often we are in person. If that returns to a full 5-day schedule, those costs will probably increase beyond that. There are some funding sources out there. We did get some good news on the budget. We're going to apply for every available funding source that we can find. As I think Lori's mentioned in the past, we had $100,000 from the United Way. We've applied for funding from FEMA to cover some of our PPE. That application was initially approved. Now we have to tell them exactly how we're going to spend that money. That's up to $1 million in funding, but it's not a per dollar reimbursement. We get 75 cents on the dollar. So we're exploring any option that we can to fund PPE, as well as the additional needs related to the cost of operating in a pandemic environment, both with the virtual campus, with the hybrid model, and with remote and eventual return to full-time in-person instruction.
Thanks, Matt.
I had a question for Dennis regarding the busing. And I was wondering, I know they're using these electrostatic wands, and I just wondered how many of those do we have for our buses?
Currently, we have 12. So with the two teams, we're going to have 12 in the after the morning run and 12 again in the evening. And they're going to assign approximately 10 buses to each person, and they should be, the drivers are going to, and monitors that volunteer for those positions should be able to clean their group of buses in less than an hour, maybe a half an hour, to clean each one of those buses with those wands.
Thank you. And then I know that you had mentioned how we were going to load and unload the buses so that there was limited interaction. But I also know that that's counter to what we normally do because we often have the younger kids sitting up front. So how will that be monitored to make sure that there's no, I guess, issues with the younger kids if they're in the back of the bus with the older kids?
The plan is to have the kindergartners and first graders at the front of the bus. And if they have an older sibling that's in 4th or 5th grade, unfortunately for them, because the old adage was seniority rules and the 5th graders go to the back, they're going to have to come up front. At no time will those younger children be in the back of the bus. The older siblings are going to come up front with the kindergartner. If there's 3 in a family, somebody will sit behind the kindergartner and his older sibling or her.
Okay, so it may not be exactly by drop off or
Not, it may not be. They're going to try to group them that way. And there may be kindergartners, of course, that don't have, or first graders that don't have an older sibling. They'll always be in the front of the bus. And then everybody else will try to be grouped by their bus stop. And we've never done it that way before. So it's going to take a few days for the drivers to get it all coordinated and know who's riding today. There might be a roster of a lot of kids, but not everybody will be riding. So it's going to take a little bit of time, but I think in the long run, they'll have a much more organized seating arrangement, and it'll be better for discharging as well as getting out.
Thank you.
You're welcome.
What is our bus driver situation right now, staffing wise?
We're hurting right now for bus drivers. We've lost a few in the last few days because people are afraid to come back. We've had 2 people recently pass their tests, so we lose a veteran and we got a rookie coming on board. And so when school opens, if we go according to the plan, we're going to be okay for the elementary and the middle school. But as we get to the high school, we may be borrowing drivers from other Durham locations that aren't starting until January or later, and they continue to recruit, looking for more people to come in and drive. But we have lost a few drivers, and it's noticeable.
Dr. Shaner, can you talk for a minute? So I've heard comments and questions like, why are we even having busing? I mean, because it is a staffing problem right now, and it is a logistics issue and a cleaning issue. So if it's a valid question from the community. Why are we busing students?
Well, I would say from an educational standpoint, it's an equity issue. Although many of us might be able to drive our children to school or may choose to do that, there are people that are unable to do that for a myriad of reasons, and those kids need that transportation, and that's been proven time and time again. I'm going to ask Dana. Dana has a pretty good handle on the legal aspect of when and how you can offer transportation and not offer transportation, but first and foremost, for me, educationally, it's an equity issue. We want to make sure that everyone has equal access and to be able to get to school. And the only way to do that is to run our buses. I know it's been suggested, well, why don't we carpool and do things like that? And again, often anecdotally, we think about our own circumstances, but sometimes many of our community members really rely on that busing to get their children to and from school. Dana, can you just talk a little bit about our advice from our legal counsel in terms of busing?
Sure. So legally, you can, I mean, school districts don't have to provide busing, but if you do provide busing, you have to provide busing for everybody who's eligible. So you know that by state law or state attorney general guidance, I guess, that there can be a walker boundary of up to 1.5 miles. And our walker boundary is much less than that. And you can choose to provide busing at just the elementary level or just the, K-8 level, or you can do it by level, but you have to, if you're going to do that, you have to provide that to everybody at that level. And then there are requirements that if you're providing busing for, say, at the elementary level, then you're obligated to provide busing for those parochial schools at that level as well. And we do some of that as our normal course of business. But also something to consider is if everyone drives their child to school, can you imagine the traffic flow around those buildings? We have buildings right now that even though a lot of children ride the bus, still a lot of parents drive their children. And if you've been around Musson at drop off or pickup time, you might as well, you're going to plan to be there for a while and you're not getting around it. So our sites weren't set up for everyone to drive their child to school. They're set up so that that the buses transport many of our students. So that's just another factor to consider.
You I wanted to follow up on what you said, Dana, about, we do offer parochial schools busing when we are offering busing. So how are, the mitigation procedures that we're putting in place for our students, how will that translate to children who aren't a part of our district who will be getting on those buses? And how do we guarantee that they will follow, the procedures and the protocols that we've put in place for our own students?
That's a great question. And, so our transportation team is working with the schools that we provide busing for. And so that'll be part of that discussion that just like anything else, they will have to follow our protocols. The timing of buses, the timing of the bus runs and all of that is something that we discuss with them every year because their start and end times might be a little different than ours, but they have to fall into our patterns. So that kind of discussion is going on right now.
And I mean, they've been in session and our district hasn't, but we haven't been providing busing to them, have we? Okay.
No, we're only required to do it when we do it for our own kids.
We have Safe Ed that will be coming back with us also to help us manage traffic around our schools and our security as well.
Thank you, Dr. Shaner. That's a great point.
Any other questions from the board about this specific topic before we move on to curriculum and instruction? I don't see any. All right, I think C.A.R.E, you're up.
Before C.A.R.E's up, I just wanted to, I want to introduce C.A.R.E first of all, but I just would like to say that in this presentation this evening with the protocols that were put into place by our COVID task force and leaders, it was with the intent of exactly what we aspire for all of our stakeholders in this community, that level of confidence that they will be safe, valued, and respected when they come back to our schools. And this checklist that was put into place last week was done by our community of administrators, our staff members, so that staff coming back today could see and feel safe that we had made those arrangements to put them in place. So the COVID task force, who we have met over the last 6 months, have produced this artifact, which I want to just extend gratitude and hopefully assurance to our staff members and to the students that will be coming back to us that mitigating safety protocols and education is a priority and will continue to be as avocational for this for teachers coming back today as we will throughout this whole pandemic. So with that, I'd like to turn this over to our curriculum team. I'm just honored to see our staff members who are in the classroom. I love seeing your classroom, Bridget. I need to come over and just walk in your classroom. I think it really reflects our compelling why. And with that, my esteemed curriculum team colleagues are going to overview the learning environments and do some clarifications about the hybrid component that we've talked about. And again, as Dr. Shaner said and Tanya pointed out, throughout this program this evening is what the Oakland County Health Department has identified as a venue for us to start phasing in and bringing students back to school. So with that, C.A.R.E, I'd like to have you begin the curriculum instruction presentation. Thank you.
Okay, thank you. We can go to the next slide. And so when we talk about learning environments, we're talking about choices that were provided early on, and we recognized way back you know, in the early summer, late spring, that we would have to have some options for families, because we knew that there would be families who were not comfortable coming back to school in person. And so, and at that time, we did not have a viable virtual option for those families. And so we got busy and explored a lot of options with a lot of people, and ended up developing our own virtual campus. So we had the option for people to either be in person, which would be remote as needed, and then also the option of a virtual campus. So we knew that going on, and we had to ask families to make that difficult decision, and we fully recognize the difficulty in that decision, but we had to have that by early August so that we could schedule all of our classes, and that we could make sure that we had teachers assigned to all of those classes, which was a Herculean task. Very, very proud of our administrative teams at the buildings who made that happen. And it was very, very tight time frame and very stressful time, but we were able to make that happen by the time that school began on September 1st. So we started with our two things, and obviously we started with our in-person learning being actually in a temporary remote setting. And since that time, we've had curriculum nights. Everyone has had an opportunity to meet the teachers in their building and the teachers that their student has. We've done materials distribution, which has been another huge task, and never really had to think about materials distribution by sidewalk before. So, you know, getting the right books in the hands of the students who needed them, along with band instruments and everything else that a student might need. That was all accomplished in short order. As we know, time's like flying right now. So much happens in a day, so many decisions. And then the current health conditions allow us right now to consider coming back to in-person learning. And our vision for that is like that it just doesn't make any sense to go from 0 students for 6 months in school to 15,000 students in school the next day. So we are looking at a scaling up, and I think the next slide, Mr. Heitch is going to talk a little bit about what that might look like.
Yes, thank you, Mrs. Lawler. So we have said over and over again, and we truly believe it, that the best thing that we can provide for our students in our system is a contact with a loving and caring teacher. What we've learned is that happens now in several different learning environments. But our vision is to continue to be able to provide in-person learning so we can continue to learn with peers back in a more social setting with risk mitigation factors, begin to reestablish classroom communities in person, develop those interpersonal skills that come with in-person learning and being in a more collaborative setting, and promote the social emotional well-being. That has been at the forefront. So when we talk about our scaling up, and this has been shared with the community and we'll share it again, we do have quite a few programs going right now. So we have been in the process of getting students back on campus, getting staff back on campus in a very strategic way. Right now we have our adult education that's been running. Clubs and activities are back up and running again. We've had some student interventions and evaluations happening on campus. Our pre-K started up on the 22nd. We've had some school age care programs actually going throughout the summer and currently now, and we're evaluating what school age care we can offer as we return to in-person learning. Our food service has been a major part of our scaling up and getting things that families need in their hands. And obviously middle and high school sports have been a part of our scale up. So lots of things have been happening that unless you were directly involved in them, you wouldn't know outside of from a communication. But our scale up process is ongoing as we get closer to that in-person learning. I'm going to turn it back over to Mrs. Lawler to talk a little bit about our hybrid learning.
Yeah, I think Dr. Shaner actually mentioned at the very beginning in our timeline that we didn't know until August 20th, shortly before school began, that we would be allowed any flexibility in terms of days and hours. And so once we learned that, we began to reshape a little bit about what our learning might look like. We also had to really take into consideration the cleaning protocols. And at the secondary level, for years, we've always offered 6 class periods per day, which would mean 5 times that this elaborate cleaning protocol would have to take place. So we kind of started there and in the secondary world made a day structure so that only 3 class periods per day would meet, and they would just do an extended period of time, gives you a little bit more time to dig into the topic and the material. And then would only require 3 deep cleanings throughout the day, depending on lunch and so forth. So we had to talk to a lot of teachers and a lot of principals and a lot of staff members to kind of come to this. So the task force started all of that work and making those plans. And then we brought in each level, the elementary and secondary has a group of teachers that represent all the different departments at secondary level and all the different buildings. And then at elementary, I think it's all the grade levels. Yep. And those groups meet. C.A.R.E meets with the elementary folks, and I meet with secondary. And so I had a chance to talk with them about what's the best option for this. And then our bargaining groups are in constant conversation about what the best approaches are for how to handle the hybrid learning. So knowing that we didn't want to go 0 to 15,000, we had to figure out the best way to bring kids back in the most safe way. And even though we know it's temporary and it'll change again, what's the best way to do that for right now?
And
so,
C.A.R.E, that 90 minutes, that's kind of based on some of us that are a little bit longer in the tooth, based on how high schools used to run block schedules, and we had a little bit of experience. We were able to really rely on our experience.
Absolutely. And some of us have taught in that method before, where you're seeing half your kids each day. So, and it does allow for a different kind of teaching. So it'll be, I think our teachers are going to be pretty comfortable with it. I have heard many of them say, especially in the remote learning phase that they've been in this 90-minute, that it just goes by so fast, and before they know it, their time is done. So I think that we will, it'll be a more comfortable setting, I think, with less changes throughout the day too, less chance of getting involvement with other students. So trying to keep the cohorts together. C.A.R.E, are you taking this slide?
Yeah. As we talked about with the health matrix at the beginning of our presentation and the cleaning protocols and other mitigating factors, we're at a point where we have to decrease density within our building, or it's advised to. And that's really the main factor that the hybrid learning model gives us right now. It allows us to get kids in school and adhere to those greater risk mitigation practices. Another thing that it does is it begins to get us back in a position where we're maximizing in-person instruction. It is another change to schedules. We recognize that. It's another change to how learning may progress throughout the week, and we can talk a little bit more about that after this. But we're beginning to maximize in-person minutes. This is, from an elementary perspective, one of the models that we've seen districts around us talk about is trying to cohort within an AM PM. It was something that we benchmarked and something that we actually went and observed. And what we found, and it worked for them, so this is not to disparage, but when we looked at full days and a full day and a hybrid in our scenario, we were actually gaining around, on average, 100 extra minutes within that week, within those 2 full days, as opposed to 2 modified half days. So it was important for us that we did that. And just to clarify, on average, on that last bullet, it's the average of districts around us who have chosen an AM/PM model in how to cohort AM/PM. And the other thing to remember, to Mr. Zabit's question earlier, contract tracing becomes much more complicated in an AM/PM model if you have something potentially take place in the AM, and it may shut down school for the PM kids that were coming in. Go ahead and put it on the next slide. So I'm going to turn it over to Marnie Barker, principal at Hugger, and Dave Pontius, principal at McGregor, to talk a little bit around what the hybrid learning model looks like the first 2 weeks for elementary students. And again, to reiterate what Mrs. Lawler shared, this has been a very collaborative process with our teachers groups across the district. That in our CTL, they are elected by, and they nominate, and if they need to, there's an election by their peers, and they're representative across our district and across departments. It was really important for us as we began to look at potential schedules. So Mrs. Barker, if you wouldn't mind, talk a little bit more about the hybrid learning model.
No, absolutely. Thank you. In looking at this model that we're moving to, I really have to reiterate what Mr. Height said, is that the CTL, the Councils of Teachers and Learning, had so many great opportunities for sharing. We just met actually as recently as this afternoon. So when we look at the schedule that we're going to be moving into for October 5th through the 9th, that week, Monday and Tuesday, we will continue to follow our temporary remote schedule that we've been living in. And Wednesday will also follow the temporary remote learning schedule. The changes will then begin on Thursday, the 8th, which we meet, you can see the early start times, which are our normal half days for both early start and late start. And we will be in person with our cohort A students, and they'll come for the morning. And then on Friday, cohort B will be coming in the morning. So you'll see some terms that I really had some great input from the teachers I met with today. They really wanted me to clarify new terms that we're all learning as we move through this pandemic as a whole. And asynchronous and synchronous are probably two that we need to clarify and remind ourselves. But with, we talk about synchronous learning, we're talking about when we're live with kids, whether it be kind of like we are right now in a live model like this meeting, or if in just a few weeks, our kids will be live with us in person. So that's when we talk about synchronous instruction. Asynchronous is going to be more independent, where students will follow those key Google slides that will be prepared for them. So when you see those terms of synchronous and asynchronous, that's what we're speaking about. That was important. And then you'll see also the schedule in blue at the bottom, where we will have our special programs such as ASD, SXI, CI, and EI. We'll be following those in person like we've talked about earlier this evening. We're bringing those learners back a little bit sooner. So we can go.
And I'm going to hop in real quick, Marnie, just to add to what you began to share. And you can go ahead to the next slide, Lori. But the importance of our Google Classrooms and our learning management systems don't go away. You know, they're probably going to be a part of our lives and our staff's lives and our students' lives a large majority of this year as we navigate the fluidity of what can take place. So it's important that we still stay in contact with that. But again, we'll be maximizing that in-person instruction as we go. And then just to clarify some thinking around the half days, and you know, why not just start with a full day? Again, we have not had students on our campus in full force and even at a less density since March 12th of last year. Actually, I believe the date was March 11th. That's 6 months for you know, our current first through current fifth graders at the elementary level where they haven't been in school. And we cannot overlook that part of this dynamic that we're working within. We know our kids are going to be excited, but they're also going to be feeling other things they typically don't feel on a first day. They're also going to be coming to school on a first day with already having potentially some pre-formed relationships with peers in their class and with their teacher. We had the honor of having a pilot TK meet and greet, and I had to remind myself, I was blown away that the teachers knew all the kids' names. And I had to remind myself that they've been connecting, you know, for 2 weeks online, and they're starting to learn a little bit more about each child in that class and each family in that class. So the half days are truly to onboard and scale up, getting kids back in the physical facility of a school, getting over those nervousness, like Mrs. Bull, like you mentioned, of driving to the school and not knowing what it was going to feel like. Is it still going to feel like elementary school? Is it still going to feel like middle school? So we feel we can accomplish that by starting on the half day approach and then getting back into full day models beginning on the 12th with our cohorting. And again, not to be long-winded, but naturally when we talk about cohorting, some of those questions start to come up. Marnie and Dave, do you want to talk a little bit about the cohorting process at the elementary and how those groups are being formed?
Yeah, absolutely. Thank you, Mr. Heitch, and thank you, Marnie, for presenting the schedule. So earlier last week, well, even before last week, we had many discussions on how to best meet the needs of students, families, etc., going through this cohorting process. First, we started off looking at it alphabetically, and as we go through each iteration of the process of scheduling students and cohorting, we realized that some mitigating factors arose as we were planning for this. So what we are doing right now is ensuring that we are doing everything possible, that families are sticking together, coming to school on the same day, looking at factors such as, okay, we have TK students from feeder schools that are coming to the TK school, communicating and collaborating with that building administration to ensure that we are keeping the kids together and that they're coming to school on the same days. So we are doing everything we can possible where the children that are in cohort A will be in cohort A with their siblings, and in the event that they are coming from another feeder school into an elementary program such as TK. Mrs. Barker, is there anything that I may have missed that would help clarify for the community and the board?
I think it sounds great, Mr. Poncius. Thank you.
Dave, can you speak just a little bit when we expect to have cohorts in parents' hands? I know there's a lot of angst in terms of needing to make plans with childcare providers and or relatives for childcare.
Absolutely, Dr. Shaner. Thank you for pointing that out. That is a huge factor for families. Last Friday, we met on this, and over the weekend, administrators and staffs are working diligently to get everything together. We are hoping to get this information out to the community. By late day Wednesday, we need to submit our information to Cindy Linner and technology to help develop the electronic messaging that's going to go out to the community tomorrow by noon days on. So we're looking for a very fast turnaround.
Yeah, and just as a point of clarification for the board, the reason the cohorting a complicating factor is, of course, once the cohorting is designed, it's got to interface with the routing software from transportation.
Yeah, so the big takeaway that I want the community to be aware of is we'll have internal lists developed into the software folks and the folks that have to do all the work on the back end in our technology department, in our transportation department. Goal is noon tomorrow, and it's a goal to get a mail merged Sky message to individual families on Wednesday. And just to reiterate, at the elementary level, we were really looking at density by classroom because we're dealing with one class. We're not dealing with 3 across a day or 6. So it may look a little different at the secondary level, but we've had teams already talking vertically to number one, make sure that we can get as many of the same households in the same cohort as possible to start. But we also know that individual families may have some circumstances that have them in a position where they feel the need to reach out to a building principal and a building administrator to look at what may be better for their family. And we'll work through that process as well. So we're going to start with elementary and notify those folks hopefully by Wednesday morning. That is the goal right now. And assuming we don't have any hiccups along the way, we'll be able to meet that goal with some instructions on how to view it as well and check. And it's just another field in their student information system so that it'll be there. But if something does come up for individual families that they feel the need to connect with a building administrator to talk through options after those cohorts are assigned, we encourage you to reach out and we'll see what we can do. So I'm going to turn it over to Lori, if you want to go to the next slide, and we've already been introduced to Ms. Davis and Ms. Cunningham from McGregor, but just to share a little bit about the elementary teacher perspective as we slide into this hybrid learning approach.
Absolutely. My name is Sarah Davis. I currently teach first grade at McGregor Elementary. I want to thank the Board of Education for inviting myself and my colleague Bridget Cunningham to present to you this evening. As my colleagues have mentioned, we are moving into the hybrid learning model. And I just want to give a little bit of an overview as to what a typical day in the classroom might look like. And again, this is just what I might do in my classroom. It might look slightly different across the district in different elementary classrooms, as each teacher will need to design his or her schedule to best meet the needs of their students. So while each cohort attends their respective days in the classroom, I plan to follow the workshop model for reading, writing, phonics, and math that we have been doing for the past couple of years through the Teachers College Reading and Writing Project curriculum. That involves starting off with a mini lesson, moving into independent practice with the students, while teachers meet one-on-one with students and in small groups while keeping physically distant in the classroom. And those lessons, we will have lessons recorded or videos posted in Google Classrooms for those students that are completing the asynchronous learning at home. we will use, I should say myself, I will use the Google Classroom in class when it's appropriate for my younger students, just so that they become familiar with what the Google Classroom looks like as they go home the following days to complete their asynchronous learning at home. If you could go to the next slide, please. Oh, I'm sorry, we could scooch back. So for the students that are at home on a particular day, we will they'll be engaging in the asynchronous learning. So materials and or videos will be provided in each of their respective Google Classrooms. As an elementary teacher, we were asked to create different Google Classrooms for each of our core content areas, such as reading, writing, phonics, and so forth. And those different videos or materials or lessons that will be posted for the asynchronous learners that day will mirror what our students in the classroom are learning, so that there is not a loss of any instruction, and it's equitable for both groups of students. And one of the ways of doing that is providing just a daily schedule. It can be something very brief, and again, that's not something, it's just one option that teachers could utilize just to make sure that parents at home are able to keep up with the learning that is going on in the classroom, so that their children at home will not miss out on anything. So links can be posted to the Google Classrooms. Excuse me. Materials, videos, assignments, and when students submit those assignments, or if parents for the younger students are submitting it for them through a picture or whatever it might be, teachers are able to give specific feedback and even submit private comments on their work. I know, just speaking from my classroom, I've been able to do that for any of the math homework that we've been doing or math assignments. I've been able to send private comments to the students based on their work, giving them encouraging tips, and just thanking them, for continuing their learning at home, even though it might be a little bit tricky. Another way of checking in for those students that are doing their asynchronous learning at the end of dismissal, I would be able to check in, maybe have a 20 to 30 minute meeting or so with those students who were completing the asynchronous learning at home, and just check in. They could hold up a sample of work they've done. We could do a writing share, a reading discussion, doing a social emotional check-in. Every teacher will just have to decide what best fits their child's needs and their students' needs for that particular time. There's not really a form or a specified schedule as to what that would look like, as it needs to be flexible based on what the students will need. And also with that checking in portion with the asynchronous learners, it's going to be up to each teacher if they want to do some sort of exit ticket type question, just to see how the students learned that day. Whether it be reading, writing, math, science, social studies, whatever it might be for that day. I know the teachers will be able to do what's best for their students to see who got the concept, who needs a little bit more review. And that's what we can do on those Wednesdays, which my colleague Bridget will talk about in just a few moments. Because of the small number of students in each cohort group, as the administrators have just mentioned, I think personally speaking for me, I'll be able to have just a little bit better understanding of how they did that day. I'll be able to check in with my students that are in class, and then again, having a short little meeting at the end of the day with those students that were at home. We'll also be able to use that time on Wednesdays for check-ins, whether that be academic check-ins, one-on-one check-ins, social emotional check-ins, whatever that might be. So as this will be a little bit more work on the parents, we're just going to form, it'll be a little bit more of a collaborative effort between myself and the families of my students. As some students, especially speaking for our first graders or younger ones, they'll need a little bit more of the support in accessing and navigating through that technology piece and getting onto their Google Classrooms, especially as this is all new, a little bit new for them this year, as it is for everyone. And we'll just be in constant communication with the parents and being available for what they might need. And I'm going to turn it over now to my colleague Bridget Cunningham, who's going to speak to a little bit about what Wednesdays might look like for all students in a remote environment.
Yeah, actually, I'll add a couple points real quick, Sarah, and you did a fabulous job kind of capturing what this new environment may look like for us in a couple weeks. She really touched on a key point that there still is an art to teaching. Our individual teachers know their classrooms very well at this point and what they're going to need and how they're going to best be connected with in this asynchronous environment. So while it's important that we come up with structures and parameters and schedules, it's also important that we don't take away that art and that decision making as the instructional leader of that classroom and find that balance there. Another key point which is going to be very helpful for us is at the elementary level, our partnership with Teachers College, our work with Everyday Mathematics, Serial City Science have all created accompanying pre-recorded lessons that go with what our teachers would be doing live. So we actually have mini lessons or guided instruction that is already pre-recorded that our teachers can tape. And then the other piece is, asynchronous is a great opportunity for our kids to apply what was taught in person and continue that. So really good picture there captured by Sarah Davis, and I'll turn it back to Bridget to talk a little bit about what her approach will be for Wednesdays.
Hello. So first and foremost, I want to thank everybody for having us tonight. Me and my colleague Sarah have been talking about this for the past couple of days. So I just also want to thank all the parents. Their support throughout this has been critical, and it really will be on Wednesdays specifically. So Wednesdays as of now are from 8:30 a.m. to 11:30 a.m. and it is synchronous remote learning, which means that all of the students were live together. It may include Zoom lessons with the teacher, breakout rooms with classmates, real-time discussions, which I think for any age is crucial, and just other forms of delivery and interaction. The one thing that I think all teachers can agree on, and like I said, what I say is not set in stone by any means or structured to a T, but making sure that our class still feels like a community. Right now, that is most crucial. So like Sarah had mentioned, having those check-ins with each other, mixing up those groups for breakout rooms. So students are having contact with kids who are not in their cohort, but are still part of their class family. As we know that we still have phonics, we still have science, social studies, all these other academic subject areas that we want to touch on. We want to make sure that students are feeling loved. I know that I was talking with Sarah about how I do a catch-up time every day, and that's just something I personally do in my own classroom. And it allows students to finish work because technology is hard for some of these younger kiddos, and just learning it has been a crucial process. So we want to make sure that they're not inhibited by that, and allowing that time in breakout rooms to contact me, to actually have that one-on-one and to actually talk with their teacher. And they're like, wait, you showed up? Of course I'm going to show up. I'm here for you. And just them hearing that and feeling like part of a community is huge. And mixing up those groups so that they, if they do come back or when they do come back to in-person full schedule, that they know that their classmates weren't just their cohort, that they know that every single member of this class is part of this family, and that we will keep calm, cougar on, and wash our paws. So I think, like Sarah mentioned, we will still be teaching curriculum, but there has to be that flexibility piece in small groups, knowing, ooh, I noticed that a couple of my kids who were asynchronous and with me in cohort A didn't get something. I'm going to pull them first to make sure that they can succeed in future lessons. Using that time together and just having them work together as a team is huge and crucial. So as much as I love seeing all my kids like this right now, I am so excited for this opportunity to have them grow together still. Sarah, back to you.
Thank you guys very much. That was awesome. I love the enthusiasm, and I think that captures equal parts nervousness because we've all been away from our kids since March 11th, but excitement to start building this new community and this new temporary learning platform of the hybrid environment. So I'm going to turn it back over to Mrs. Lawler, and she can start navigating us through what secondary will look like.
actually, I'd like to introduce a couple of people who are living this on the daily basis. First, I'd like to introduce Mr. Pasquale Cusmano, who's the principal at Adams High School. He's going to talk about the hybrid learning model and cohorting, and then he will introduce Mrs. Monica Warwitz, who is going to talk with us about the teacher's perspective from a secondary lens. Pasquale?
Well, hello, Dr. Shaner, executive leadership team, and members of the Board of Education. Great to see all of you tonight. So a couple details. The elementary, you know, we have a lot of similarities and also a lot of differences, as you know, from secondary. But as our committees were looking at all the different cohort models out there, because that's what we do in Oakland County and the state, and try to steal great ideas from other districts and other people. You know, we started to look at how we can create our own and take all the good pieces of all the different cohorting models out there. You know, we agreed that we wanted to maintain some consistency with our remote learning schedule, where we do Monday, 1, 2, 3, Tuesday, 4, 5, 6, and kind of repeat that pattern, because we know that it's a possibility that we will be, or possibly might have to go back out on remote learning. So we wanted to make it consistent for staff and students if we had to do that. And a couple of things we were working on is decreasing density of our buildings by 50%. That was one of the criteria that we were kind of focusing on. And to do that and to start scaling up, bringing kids back to school, we talked about creating 2 cohorts, and you heard about that, so I'm not going to get into too much details, but same thing at the high school. We're going to create a cohort A and B alphabetically, you know, A through K, L through Z to start, and then we're going to have a process in place for families who might need to request a change to accommodate a need, and then we'll look at those case by case. So start looking at the schedule a little bit. Same thing. Middle school starts Monday, October 12th with this hybrid model, and high school starts on Monday, October 19th. So we're starting middle school on a Monday and then high school on the next Monday, where we're starting with this schedule. If you look at the schedule, for example, for high school, for example, because I'm a high school principal, that's where my mind is. On the 19th, we'll be starting with cohort A, in person, hours 1, 2, 3. While cohort B is learning at home, asynchronous, some lesson provided by the teacher that they're working on. And then Tuesday, we're working 4, 5, 6 in person, and then cohort B is at home working. On Wednesday, teachers will be meeting with every class that day for a half an hour. That schedule is to be determined still, but teachers will be Zooming in with their students or Google Meeting with their students every class to touch base on the students who were in person and the students who were learning at home asynchronous. And then we kind of repeat with the other half. On Thursday, cohort B will be in person, 1, 2, 3, and on Friday, cohort B will be in person, 4, 5, 6, with cohort A at home learning asynchronous. One thing I wanted to point out is every day at the end of the day, if you notice that the school ends at 1:45 or classes in person end at 1:45, that's given that we saw that model out there, and we wanted to give that opportunity for our teachers to have 45 minutes to touch base with their asynchronous students. So that's every day. The teachers will have open hours for kids to reach out to teachers during that 45 minutes till 2:30, from 1:45 to 2:30, to help answer questions, guide, direct, do whatever it takes to make sure everyone's on the same page. Let's see. Wednesday, I just want to point out another thing about Wednesday. So attendance will be taken on Wednesday. That is a mandatory session. That is not like a office hour type session. So Wednesday is 1 through 6. Teachers are taking attendance and meeting with all kids on that day via Zoom or Google Meet or whatever they use to meet with kids live. Also, just wanted to point out another point with this is one of the factors of doing it this way was it gives us cohort A meets on Monday and Tuesday, and then they're out of school Wednesday, Thursday, Friday, Saturday, Sunday. So in case that we have a COVID case in cohort A, we have 5 days to contact trace. We have 5 days to make sure we are finding out who was in close contact with our nurses, with the health department. So that was another reason of doing this as we scale up in this temporary remote or temporary hybrid model. So those are some of the key things that I wanted to kind of point out about the high school model, which is very similar to the elementary. But Mrs. Lawler.
Thank you. Thanks for covering that for us, Mr. Kuzmano. And then there, on the bottom of that, we did not mention that there are some special ed classes that are maybe a little bit smaller already in our program classes. So our ASD students or CI students, since their classes are already smaller, and because routine is so important, we will bring those students in on all 4 of the days. So they'll be cohort A and B. And I think Mrs. Lewis is going to speak to that in a little bit as well. And then I would like to introduce Monica Warwitz, who is not only a science teacher, but the science curriculum consultant for middle schools. And she's going to talk a little bit about what her plan is for hybrid and what that's going to look like.
Thank you. Good evening to the board and community that's watching. Thank you for this opportunity. The first thing that I wanted to mention is all summer, our staff has been training very hard on their own time, learning on their own for the best ways and methods to teach remotely. I'm mentioning that because part of the hybrid method is going to be designing activities, lessons that kids will be doing online. And we've trained for this. This is a quality, hardworking group of teachers, and we're ready to deliver online lessons as well as in-person lessons. I am very excited to be back in front of students, and I'm very appreciative of all of the measures that have been taken to make sure that it's done safely for staff and for students. Mrs. Lawler mentioned that I'm a teacher and a curriculum consultant, but I'm also a parent. I have a middle schooler at Hart and I have a high schooler at Stony Creek. So I'm kind of able to look at this through a lot of different lenses. I'd like to go over kind of my thinking for how this might look in my science classroom. So when students are face-to-face, I kind of think of this as a time to level the playing field. So I might do an anchoring activity with students. And what that means is that I might show them a discrepant event, or I might show them an experiment that maybe they can't quite explain, something to trigger their thinking. The next thing that I would do is to go over and give them an opportunity to uncover their thinking. In the science world, that means they might do a lab, they might do an activity, they might have some sort of an interactive experience where they're trying to make meaning of what they're seeing. And that's really helpful to do when they're together. And then finally, we would, in the face-to-face class, be able to have discussion. Science and actually all subjects in school now are very social, and we need to have kids talking. And we can do that online when they're in breakout rooms, but it's really better to have them together and face-to-face so that we can use the teacher talk moves that we know. And we can teach kids and demonstrate and model for kids how to rephrase and how to ask questions of other students. And I picture that occurring during the face-to-face time. In middle school land, and I'm old enough to remember this because I've been in the district for almost 30 years, we had block scheduling for a long time. So teachers are used to dealing with a 90-minute class time. And we know that that's actually a really great time to get a lot done with kids. And if we're not going to be dealing with kids coming in and kids leaving every 55 minutes, we have a nice solid chunk of time to get things done. So that would be my face-to-face experience for kids. The asynchronous part, because I mentioned at the beginning, teachers have been working so hard on those online, really rich, quality instructive lessons. When kids are not in front of us, there is still going to be quality learning going on.
because we know how to do it. We've been practicing. The district has had multiple days of training for teachers. So during that time, students might be doing readings that reinforce things that they did in class. They could do progress checks. They could do a gizmo, which for those of you that aren't in the science world, gizmos are for math and science, and they're very interactive, but they're computer generated. So students can pick different variables. There you go, it's right on the screen. And there are multiple gizmo opportunities for kids. They're matched up with all of the standards, and teachers can go in and search by standards, and they can choose gizmos that best match and reinforce what they're teaching in the class. We just had professional development on Wednesday with all of the science teachers and the people from Gizmo, which is the Ed Learning people, for how to use them. How might you use a gizmo to even drive, like, oh, they had a problem up on the screen where we were challenged to spend the least amount of money in manipulating variables for who could grow the largest plant, and you could pick seeds, and there was a whole number of things that you could do. But this is a wonderful asynchronous lesson that teachers could assign to kids. The students and the teachers are very practiced in using Google Classroom. We've been doing that since the beginning. And whether kids are in front of us or if they're home, they still know how to access that learning platform. They still know how to turn things in. They still know how to ask questions using the Google Classroom chat feature. So all of this training that we've been doing with them is going to pay off in this hybrid environment that we'll have. And then finally, I wanted to speak to the synchronous parts, which are on Wednesdays. Those are 30-minute sessions, and there's a lot we can do in that 30 minutes. We will be online with the kids. So again, this is the mode that we've been using in remote land for the last few weeks. We can reinforce skills. We can, the science world, again, we have a lot of practices that scientists do. It's not just about memorizing science information for Jeopardy. It's about how scientists actually do their job and the practices that they have. So we could do a short lesson on, how do we analyze data? How do we argue from evidence? And all of those pieces that we can do on Wednesdays will support and reinforce things that we're doing in class in our lessons. So I anticipate as a teacher being able to make great use of all three of these different ways of being with students. And so that's my vision of how I would spend my time. Again, as my elementary colleagues pointed out, it does vary from teacher to teacher and discipline to discipline, but we know how to do these things. We've, like I said, we've had a lot of training in this area, and we know how to use those extended periods of time. So just to sum up, this hybrid mode that we're in is also going to be a highly quality piece of instruction for kids, as was the synchronous, and as is being able to be with kids all the time in school. So thank you for the time.
Thanks, Monica. I appreciate that viewpoint. Concetta, are you on with us tonight, Mrs. Lewis?
Yes, I am here. Good evening, everybody. We've already heard a little bit about some of the plans for some students that are eligible for special education. The vast majority of the students who have individualized education plans or IEPs within our district actually spend the majority of their day in a general education classroom receiving instruction from a general education teacher with their general education peers. So our goal during this face-to-face time is really to maximize the amount of time that our students have in front of those gen ed teachers, getting some of that specialized instruction from the gen ed teachers. So most of the students that have IEPs will follow, be in either a cohort A or cohort B and follow that schedule. At the secondary level, each hour of the day, if a student has resource support, that is built into their schedule, and they will receive that schedule according to the hybrid plan. At the elementary level, again, our goal is to maximize the amount of time that the students have in the general education classroom, accessing the general education curriculum, which is really the ultimate goal of the IEP process, and utilize the students' asynchronous learning days as times when they can engage with their specialized instruction from a special ed teacher or a speech therapist or a social worker. The other piece of that is, again, we're offering the 4 days of support for those students that really have some much more intensive needs than most of the students who have IEPs in the district. And as we talked about, those classes are typically much smaller, less than 10 students per class for each one of those classes. So students in those categorical classrooms will continue to attend 4 days per week. The other piece is that when we think about some of the providing some of the ancillary services, and even with the governor's recent executive order requiring masks for everyone, having the capacity to provide some of those, when you think about providing speech service with a mask on, that really is something that might be better served under the current state through an online or remote means, because it gives that face-to-face, true face-to-face opportunity. The speech therapist is able to see the student making sounds. The student is able to see the speech therapist. So this actually might be a better means at this particular stage of where we are in our scale up for these particular types of supports. As we think about just overall how this looks, for the secondary, again, the hybrid learning model, when we start off for next week, what is that going to look like? So for students at the secondary level, students that are cohort A, they'll continue with their remote learning schedule. Students in cohort B will continue with a remote learning schedule for the entire week. However, students in those categorical classrooms, they will have half-day sessions every day next week. And the goal of those sessions is really, as C.A.R.E talked about earlier, many of those students having a routine and structure is very important for them. So the goal of next week and the week after for some of our secondary students will really be helping them to get back into those routines. Because even at the same time when school closed down in March, many of those students were also at that time engaged in some outside services, outside therapies, such as applied behavior analysis. But all of those services stopped in March. And so for many students, they really haven't had any type of service or support in school or outside of school for the last 6 months. So this will give us an opportunity to really begin to build back some of those structures, help them develop some of those routines that they have not been adjusted to in quite some time. You can go ahead to the next one, thank you. And then for our post-secondary students, we're starting them 5 days a week with a half-day schedule. And part of the consideration in deciding the team coming up with this plan, and these plans were developed for these specialized groups, what we did is we went to each of those groups. We talked through these scenarios with them, and they really came up with the plans and presented the plans to me to say, is this an acceptable, can we move forward with this? So each of these groups really got together and worked through these plans. As we think about the students that are adult transition program, many of those students typically would spend a significant portion of their day within the community. And because of where we are still currently in the COVID-19 phase as a region or as a state, many of those opportunities are not currently available to them. So what we've decided to do is to start them with, consistent structure again is important for this group, but having them come 5 days a week to begin to build some of those skills as we look to say what opportunities are beginning hopefully to open up, and then we can expand their school day as we get more opportunity within the community for them. And I think that is it for me. Yeah.
Thank you, Mrs. Lewis.
You're
Awesome
welcome.
update. And as we started this segment, we said that there were two options. One of them is what we've been talking about, scaling up from remote to in-person. The other one is our virtual campus. So let's just have a little bit of an update from Principal Jeff Frankowiak and Assistant Principal Brian Lindstrom.
Thank you so much, Mrs. Lawler. Hello, Rochester Community Schools. To the Board of Education, Dr. Shaner, the leadership team of the school district, some of our teacher colleagues, it is an honor to be with you tonight. As Ms. Lawler said, my name is Jeff Frankowiak, and I'm the proud principal of the virtual campus. It is now 3 hours and 15 minutes into the journey, so if you would like to stretch, just turn the volume up. I'll go through everything in an audio format. So first off on your screen, you'll see that we have our enrollment. If you are good with math or you're trying to do the total count, we have approximately 3,100 students in the virtual campus. That's 3,100 students whose families have entrusted us with their most precious asset, their children, to do the best job that we can to provide a new learning pathway in Rochester Community Schools. This truly has been an initiative that has involved every corner of our school district. Every department, every faculty member, every administrator has somehow touched this program to ensure its success. This program is special in many ways. If you look at virtual campuses or distance learning programs all over the state, you're going to find often there's a software package that kind of delivers the content, and you'll have these mentors that drop in. We do have a few courses that have that aspect in our program, but the significant majority is teacher created resources, and teacher facilitated feedback. Students have access to teachers more often than the majority of the programs that you'll find out there, maybe even all of them, and we're continuing to get stronger. Now, we have quite a few families that have chosen this option. We know that there are some families that if we had a virtual experience, this would be the pathway for them. This program was always in the works. It was expedited though, as our response to help mitigate or give families an option to mitigate COVID-19. We also have families who are using this as an option just to stay in a consistent learning pathway. There might be some medical fragility concerns. There might be some concerns where students need an asynchronous platform. That is what we're here to offer. And in our goal to do that, we're going to be providing a program that is meant to service all the kids who have chosen this pathway. I do want to highlight a couple things that we have students. When you think of 3,100 students, and you see that slide above you, 3,100 students means that we have about 1,750 elementary students alone. That is almost over three elementary sizes that we have in Rochester Community Schools. You can take all of the secondary students from middle and high school as well and form a large comprehensive secondary school. We're doing that all under one program, and we're doing it with a collective effort from everybody in Rochester Community Schools. Another thing I want to highlight is that students will come through our doors with a variety of needs. There could be students with social emotional needs, students with academic needs. Our goal is to help every student realize their full academic potential. And in doing that, we're connecting with teachers and we're bringing on families through personalized conversations to see how we can meet the specific needs for their child. Dr. Shaner talked about earlier in the meeting that we want to provide as much availability and flexibility for our learning pathways as possible. A lot of news has been coming out with COVID-19. And if this is a pathway that you're currently not in that you would like to pursue, talk with your building leadership, or you can always give us a call. And as soon as we have an opportunity, we'll figure it out some way to make it work for your family. So if we can go to the next slide, I'm excited to introduce our interim assistant principal, Mr. Lindstrom.
Yeah, thank you very much, Jeff. So this has been just a huge undertaking. And when we start looking at the team of educators that have come together for this, we literally have staff from every school throughout the district joining this team, something that usually doesn't happen until we have professional development days or our huge district kickoff days. So this has been really, really unique for us to take on this task to try and create a team and an atmosphere with all these different educators. At the secondary level, we have staff from all buildings hosting Zooms. And literally on the first day, they had kids from all 3 different high schools. And some of our world language teachers had all 4 middle schools plus all 3 high schools in one classroom setting. So really trying to create this atmosphere that virtual campus is a place for everybody has really been our mission for the first few weeks as we go through this. And we're still adding staff as we go through this, and it's never been done before. We keep adding staff to try and say, hey, we need some positions here, we need additional staff here to help us out as we get going. So we've really been learning as we've been building this, and I think that's kind of been our message since the kickoff, is that we're trying something creative and something brand new that we can come around and try and wrap our hands around. And if it's not working, we're going to work to try to make it work as we go forward. Just to touch upon some of the classes that were happening, especially at the secondary level, Monica touched on this a little bit earlier. We've had people building these courses since the summer, and something that would usually take about a year, we got done in about 3 months to get first semester up and running. So besides the core subject courses, we've had accelerated math classes that we added some AP classes, the performing arts classes, really some career technical education courses that we've added on. And where needed to, we've had to use some of the outside vendors just to give the kids the option and variety that they're used to in their home buildings. So we are now currently underway of working on building those second semester classes, and we have a team working really, really hard to put those together to keep going. So you can see down at the bottom, we almost have 200 virtual campus faculty members that our team is really working with. And so we're just really cranking away and hard at work to get this to be a very successful program for Rochester Community Schools. Jeff, I'll turn it back over to you.
Thank you, Mr. Lindstrom. And in that commitment, if we can go to the next slide, please. In that commitment, one of the things that we cannot do is without your feedback. And it's one of those things that this is a program that it's our program. It's Rochester Community Schools, and that community is such a fundamental part of what we're doing here in the virtual campus. And so we have stakeholder feedback so far from our families who were able to provide us some very candid responses, which we appreciate. We just facilitated our staff surveys, and actually students, if we have any students listening in from home right now, we actually will be gathering student feedback later on this week. We understand that there's some growing pains with the workload. There are some families who are saying, we want more assignments and more, asynchronous materials. And there's other families who are saying that we're having too much. And as we've used the analogy of Goldilocks and the three little bears, we really try to find that individual sweet spot to make sure it's just enough for each student. And our faculty have been responsive as much as we can at this point. Another thing is we've been getting some critical feedback in all candor on our learning management system in secondary. We're going to do everything we can to provide technical support and align our instructional practices so they're consistent between each classroom, so students will not have to navigate between 6 classes and 6 teachers. But we're also going to be exploring options for the future of the program. Again, we launched with where we were at this moment. And again, through feedback and through a continuous improvement process, we're going to make those necessary course corrections. So this is a program that serves everybody. And then of course, there's some overall logistics that we're navigating through too. I'm really excited if Ms. Roscoe from our district PTA is listening in. We're in the midst of starting the process to form our virtual campus, Parent-Teacher Student Association or Parent-Teacher Association, depending what's appropriate. And that's going to be a great way to galvanize those parents that are going to stay with us from here on out and bring students collectively together. And of course, our faculty as well. So that whole concept of our campus is going to go from there. We do want to be as accessible as possible, and for the sake of time, which is sometimes tough for us to do, I'm going to be a little bit more concise. But if you have any questions, if there's anything that we have said tonight that you're like, gosh, I want to know more, please give us a call. All of our information is rcsvirtual.com. We're also going to be having a social media presence. You can find us on Twitter at rcsvirtual or Facebook. Just look for the virtual campus. The other thing too is you're never wasting our time. If there's something you want to get a hold of us about, please give us a call. Please send us an email. Please send us a carrier pigeon. Whatever your choice of communication is, we'll do the best that we can to respond to you. Last but not least, we're very excited about the future of the program as our clubs and activities start coming online. We had some teachers just launched Girls on the Run for some of our upper elementary students. We actually have an in-house art teacher who is a renowned illustrator of children's books. We're going to be doing a school-wide read aloud very soon, and she's going to be showing our students how to illustrate some of the characters in the book. But the best thing is, if virtual isn't for you, anything we do at the virtual campus, we're going to share it with the entire Rochester Community Schools student population. So please check on for that. In closing, you've heard from all the different learning pathways, there's a couple key ingredients. A loving, caring teacher, we provide that. Rigorous curriculum standards that's made RCS the district that it is. There's no one that can dispute Rochester Community Schools has a history of excellence, and we have a very rigorous curriculum that drives our instructional practices. We provide that. we're building a school where we want students and staff to be at. We are working on providing that, and we're going to continue to get stronger each and every day with your help. So with that said, we're excited to present to you the Rochester Community Schools virtual campus. And I think Cindy Lindner is going to take it from here.
Thank you, Jeff, and hello, everyone. Cindy Lindner from Technology Services here. In Technology Services, we remain focused on the items you see here. We continue planning for our student one-to-one device initiative, where all of our Rochester Community School students will have access to a Chromebook. We have made some great strides forward on this as we have deployed 5,000 devices to our students. The next phase of our one-to-one initiative will continue in December, when we are scheduled to receive our order of 11,000 Chromebooks. As you know, Rochester Community Schools, and actually everyone in some way, has faced a lot of unknowns given supply and demand challenges, and we've all felt the impact that this can have on timelines. We are keeping in close contact with our vendors, and we are hopeful that some timelines will start to shift in our favor. As we welcome staff and students back, though, they will note that there are no Chromebooks left in our schools to support classrooms, special education, media centers, testing, and more. You see, in order to provide those 5,000 devices to students, we dismantled the mobile labs that were in our schools. This will have an impact on instruction. We are working to mitigate this situation. We continue daily to explore every option to help, and thankfully, one option has panned out. We've been able to secure a small number of devices that will allow us to provide one mobile lab to each school to support essential tech needs. Over the next few months, as we receive any new devices, there is a lot of work required to prep them for use, including receiving and storing, unboxing, enrolling, licensing, inventorying, and delivering those devices to the schools to be deployed or assembled into mobile labs. So bear with us. We will be as fast and efficient as we can, but it simply takes time for teams of staff to prep and deploy devices. Over on the operations side of the house, I've mentioned before that we tend to focus on the technology that we see or we use regularly, like a phone or a computer or a TV. However, in order for these devices to work, they run on a complex infrastructure of networks and systems. This is the technology that we don't see, and honestly, it's the tech that we don't even think about until something is not working. So our goal in technology is to support our students, staff, and schools by keeping our infrastructure and daily operations healthy, so that nobody needs to think about technology. It just works. There are many things that could kind of help us when it comes to tech and having things work, and I'd like to touch base on standardization for just a moment. Our goal is to standardize in many areas, including devices, learning platforms, processes, resources, and more. This allows us to bring a consistent experience and remove barriers. It allows us to provide one set of documentation and training materials. It facilitates our ability to support the tech and much more. So here's a quick example to see the advantages of standardization. So if, for example, we were to have 10 different types of devices, then we would possibly need 10 different training videos, power adapters, maybe 10 different ways to just turn on the device or even open an application. It also brings challenges to our ability to support and repair the devices, to stock parts, and more. So with each different device, we're adding more layers of complexity. And this is not just complexity to us in technology, but the complexity also affects our students, our parents, and our staff that are trying to either use the device or support somebody using it. So we'll continue to standardize on tech where we can to assist us all as we move forward. Something I want to note here about technology, it is really important to keep in mind that many pandemic tech solutions are brand new to our vendors. They've had to create and write programs to support this important need and put them into production in record time. So given this, we are finding that only the basics are available right now in terms of features and functionality. We want more, but it will take time for our vendors and partners to provide updates and enhancements. Again, just something to keep in mind. Okay, training and support. They are critical to our success, and we can usually lean on our experiences and best practices, right? Our playbook to help us out. But right now, we're all functioning without a playbook. There is no pandemic playbook that provides best practices and guides us step by step through this. We haven't been here before, and that goes for all of us. For technology, we have definitely not been here before. But please know that we are working every single day on our playbook, knowing that it is continuously changing. We are striving to create training opportunities, provide helpful and timely support, and even trying to answer questions that haven't even been asked so that we can maybe stay 1 inch ahead of what our students and our staff need. Throughout the night, you've heard about tech, and being candid with you all, there is a mountain of tech that we're navigating, re-engineering, and supporting. Just one data point, when it comes to support, technology services grew overnight from supporting schools and staff to supporting 15,000 students and over 20,000 parents and guardians. We are rethinking support models, reallocating staff, and tapping every resource we can to support you. So while I'm here, I will wrap up by saying thank you. Thanks to every parent and guardian, including grandma and grandpa. Thank you to our students and staff members, our teachers, and so many more for navigating tech as best you can. At the end of the day, all anyone can do is the best they can with the best they've got. So thank you all. That's it for tech.
Thank you. I think before we wind up with gratitude, I'd like to just offer the board an opportunity to ask questions for us to provide the answers to those questions. So much great information, so many great teammates that have put their heart and soul into this work, and really appreciate that. But let's shift to questions, and then we'll wrap up.
Thanks, Dr. Shaner, and thanks to all those who presented. And I was like completely wrong on my estimate of time. That's not one of my strengths. So, but I do think it's really important for us to continue to be able to ask questions. And so I'm not going to discourage any board member to, I mean, I think everything needs to be out there. So I'm just going to start out by, so I'll just ask the question that's out there that I've heard the most, and that I think all of us have heard the most, and I think needs to get out there right from the beginning. So why is it a good idea for us to go from, 2.5 days of, so essentially, why is it a good idea for us to go from 4 days of remote instruction to 2.5 days of in-person / remote instruction and asynchronous learning on the other 2 days?
I think I'll start, and then I think maybe I'll ask Corey and Carrie to chime in. I'd like to hear from our teachers and our principals on that too, who are comfortable, because I don't think there's any easy way to shift. I do think, as we've heard earlier today, phasing up is critically important, so we get it right and we don't make a mistake, and we don't end up getting someone sick or worse. But I think it's critically important that we think about the entire process of that. And as we think about shifting from remote, we've got a little bit of a balancing act here. We've got to have a great instructional time to be able to make those connections with kids and provide that instruction. We also have to have a methodology that we can cohort in a way that we can quickly contact trace. We can afford for some time with things that are challenging sometimes the health department, like testing, and still move on with our education. So I'd like to just really have Corey chime in about one more time about instructional time, and then maybe we can just loop back around with our principals and teachers about how they feel about it and why they feel maybe it's important to shift at this point.
Great, thanks, Dr. Shaner. In short, what we hit on earlier is, as part of the phase up, we're moving from 0 minutes of in-person instruction to 760 and maybe a couple minutes more of that. So that is, in one sense, the true definition of phasing up as we get to our goal of full in-person instruction, which is where we want to be. Another factor that we have to acknowledge is, through this pandemic, we've learned about our learners, and we've learned about what learning can look like and how learning is evolving. And there's certain things that have come out of this pandemic that I think will be a part of our fabric moving forward. An example of a fully virtual online platform. Yes, it is being discussed in terms of looking at different options for kids and families, but certainly, put into overdrive to make sure that we had that platform available. In the availability for our kids to transition back and forth through a learning management system, and being able to comfortably, and yes, depending on the age and the skill level of an individual student, there'll be a kind of a spectrum of support that may be needed for them in the home environment. But the ability for our kids to access content, to apply content that was learned in person at a greater scale. I don't want to speak for the teachers here, but the excitement that we had when we met as a CTL group of how deep they'll be able to go when they're back in person, in the, for lack of a better term, a traditional learning environment. to be able to read body language and react to it, to be able to react in the moment as an instructional decision maker within that classroom based on what they're seeing from a kid. And it may even be what they observe from a student in an asynchronous platform that they're now able to really dig into. So I'll stop there and let the experts that have the boots on the ground kind of add their input as well. And I'll open the forum to any of our administrators or teachers on the panel.
Yeah, and just as a follow-up, as the teachers do get, if we can hear from the teachers, talk about your workload and so how is this changing your workload to have to, you're doing essentially two different lessons. One is synchronous, one's asynchronous. Like, talk a little bit about what that's doing to the way you work and when you're going to do all this work.
I think it's definitely different. I know the workload in the past few weeks is a lot more than what it would have been if we were full in person. And, we're still learning as we go. I think we've mentioned before that it's an ever evolving process, just kind of taking it day by day and really just doing what's best for students. And not sure what that workload might be when we start the hybrid, but just trying to adapt to best fit what they need.
One of the things that's come out of this for secondary is the need to work together. So I teach 7th grade science courses, and I work with the 7th grade science teachers across the district. And, we chunk up the work, and nobody is an island. Everybody is able to contribute really good ideas to make the strongest lessons possible for all of the kids. And if we can use each other's materials, it makes the workload less.
That's a good perspective for sure.
I would add too, I haven't talked to anybody who thinks that remote learning is the greatest thing since sliced bread. We're educators who kind of like what school has typically been like up until last March. So to have the students and as Mr. Heitch said, to be able to capture that teachable moment when your whole class is looking at you like that. And right now our teachers are sometimes looking at black boxes on a screen. And it's hard to gauge where your students are. You can accomplish so much more when you're in person. So this is the best way that we know of to scale up to full in person and to get back to that place that we all really love.
I think it's important to loop back too that the health department data is such that we are not adding to risk. We are mitigating, and we feel like that we believe that it's safe. We think we can move forward, and I think doing it in a measured response also allows us to be able to not only pull back if we need to, it changes the conditions change, but if something changes drastically and we need to shift back to remote. We have it down now, right? We've got remote, we've got a virtual platform, we've got a hybrid platform, and an in-person platform. And even when we shift back to full-time, full face-to-face, we've got to remind people that that's not going to be normal. There are going to be mitigation procedures in place. There's going to be movement restrictions in place in a building. That is not going to be normal for quite a long time, I fear. We've got to remind ourselves that. So nothing that we're doing, to the point of what was said just a few seconds ago, nothing has been done before. Everything is more difficult. And if you think about that as a parent, I think about that with my own kids. Every decision you make is qualified by COVID. Everything that you think about in your daily life is qualified and complicated by it. And this is nothing different. So it's not going to be easy. Because of the mitigation and because of the safety factors, but I think it is time to get our kids back in front of our teachers. You can just sense the love and commitment that they've presented this evening, and it's so appreciated. And when I think about why I do what I do, that certainly is that connection between those teachers and the kids. And I, be honest with you, I'm a little bit jealous because I miss it. I miss it as a teacher.
If you are at McGregor next week, we are throwing a best day ever party. My class voted because we were so excited to be together. So if you're around McG, just stop on by. It's next Thursday and next Friday. The theme is best day ever because we finally get to be together. And we're really excited because Come on.
That's awesome. So as a follow-up question, so thank you for the information about the teaching aspect and the learning aspect of the hybrid. So from the perspective of a parent, because I'm both, I'm a board member and a parent. So from the perspective of a parent, a hybrid schedule is definitely more work for me. It's more work for me as a parent, because it's not dropping my kid off at school and picking my kid up from school and saying, how was your day? It's, you know, wake up, you don't have to go to school, but you have to do this work. And I don't necessarily know what the work is, and you need to know what it is. And then I think about elementary students too. What is the expectation of students having to do the work, for example, on that day during the school day? Like, I can imagine there are probably elementary families who it's probably a better option for them to have their kid maybe in a daycare or day camp situation, or, you know, even with friends or groups of friends. And even at the high school level, like if I'm working and I can't necessarily make sure my kid is doing their work, like does the asynchronous work have to be done between 7:30 and 2:30? Can it be done on the weekend? Like, what is the expectation there?
So I think that's a great question, because when we think about, again, speaking for myself, not guessing anyone else's age, when I think about my experience in school, it was within some time confines, right? And I think watching my own children, and watching how the nature of teaching and learning has changed with the addition of learning platforms, I'd really like to hear our teachers talk about that, because in a high school environment, my experience with my own kids, because of the learning platform, the learning management platform, you might get home from school even on a regular day before COVID, at least my daughter would, and a teacher might put something into Google Classroom and say it's due by midnight. And they would get home and find that out. It wouldn't be necessarily, you know, hey, Bob, you have an essay due and it's due tomorrow at the beginning of class, and this is what it's about. You would put those directions into your management platform, and your student would get that, and so they're used to that a little bit. But I would like to, maybe from the level standpoint, just kind of what expectations are, what the ability for flexibility is in terms of that. And just a quick acknowledgement that we absolutely do realize that this is, for a temporary amount of time, probably going to be more responsibility on parents. There's just no way of getting around that. But if we really believe that we want to get our kids back in front of our teachers and back in school, it's what we have to do.
Thank you. And I saw Barb, and then I saw Mike.
Yeah. So, you know, Dr. Shaner, I want to follow up on that, because I do believe that most parents, they do want their children face to face in a classroom with their teachers. But there are some parents that still have a lot of reservations about this transition and what it could look like, and specifically parents that don't feel comfortable with the idea of sending their children back into a hybrid situation. And so there's been a lot of discussion, and I know that the district is aware of it, of, you know, why couldn't there be live streaming into a classroom for, you know, in order to eliminate that asynchronous learning. So can you speak to that a little bit more? And then also, you know, speak to the issue of a lot of talk about the perception that other districts are providing more hours of instruction. And I know, Corey, you've talked about, you know, the 750 hours, but if you could speak a little bit about that too as well, that would be helpful.
Yep. Barb, do you mind if I just go back a little bit? And I want to hear Monica talk a little bit about how the learning management platforms changed the way she does her business, because I think that's an important part of this. And I'll talk about live streaming. Do you mind?
No, I don't mind.
Do you mind, Barb?
No, that's fine.
Okay, go ahead, Monica.
Thank you, Dr. Shingner. So what I usually do, let's say that I have a student in cohort A, and that would be somebody that I would meet with on Monday, first hour. If I assign something asynchronously to those students, I wouldn't expect it to be due until before I met with them again in this environment, so that we could do something with it. I always assure my students that I'm not going to assign them something that doesn't have meaning to it. So the meeting would be made the next time we were together physically. So I wouldn't have it due that night because we're not going to do anything with it that night. Does that answer your question?
Yes.
I
it
mean,
does.
that's just me, but that makes the most
Yeah.
sense. Like,
Yeah, thank you.
okay.
And I think with our youngest learners, Bridget, can you just kind of talk about, you know, how you would approach that, just so people are comfortable with it?
Yeah, so every day, first of all, I never post an assignment until I've talked about it with my kids. We have a thing called catch up time every single day where each student is in their individual breakout room on Zoom, and they are working on any assignment that they still need to work on. And during that time, I'm available at any point if they have questions. I personally have every assignment, regardless if it's sent out Monday, it's due Friday at 11:59. I don't know why the 11:59, it just makes me feel better. But I know students have that opportunity to work all week, including Wednesdays, anytime. And like I said, I do catch up time every single day. The students know the procedures, the students know what they haven't done, and I do show them that list. These are the tasks that are going to be due on Friday. So they can kind of mentally check off, okay, I've done that, I've done that. And then even during that catch up time, like Thursday, they might come on and say, Miss Cunningham, is there anything I don't have? And I can sit there and I'll check and I'll go through it with them and make sure that they have turned in everything. Or, oh, you have this. Is there something we should work on together for it? And just have that small group, one-on-one personal collaboration time. But it's usually around 20 minutes where I'm just like, hey guys, you work on this. I want them to have that time where I'm still here. Whether it's a tech issue, whether it's an academic issue, we'll work through it together. I want them to know that I'm there regardless. And it's just been really easy for them because it's a consistent for them. It's a consistent within all of this inconsistency, if that makes sense. So just providing them that time and they still know I'm there. I want them to get those assignments done manageably while I'm there. And so it's out of their hair during the school day or after the school day is done.
That makes sense.
Yeah, just real quickly, again, I think one of the unique things that we're involved with this in the environment is our teachers know what our families' obstacles are and what our families' challenges may be already. It's unique because it feels like we're talking about the first day of school because we're getting kids back in to brick and mortar settings for those families that are choosing that path. But the reality is we've had 3-4 weeks to establish communication lines between families as well. Our teachers and our building administrators know, what might be an obstacle for a family getting on at an elementary situation that we've come up with a lot is I have to drop my one child off at daycare. My second grader can't be at home alone, or my first grader. So we're navigating those things already, and we're going to continue to navigate. And new obstacles will come up with this environment as well, that between communication and flexibility of our staff and our building administrators in working to accommodate families, we'll be able to work through those together.
Thanks, Corey. So let's shift to streaming and really the questions around that. And before I do that, I want to qualify that all of this is a continuous improvement process. We continue on a daily basis and hourly basis to assess assess what's going well, what's not going well, and what we need to improve. And that goes with technology, that goes with curriculum. And when we think about live streaming, I know I've been asked that question, that other districts are doing it. And we are aware of really 2 districts that have, I would say, attempted it. One of them a very small district in Macomb County. And we continue to benchmark and watch that. But when we think about some of the larger districts, I think our timeline for returning back in a hybrid is more aggressive than most districts our size. Many of them are into November in terms of returning high school kids, and they're returning at 2 grades at a time. And that certainly could have been a possibility for us. But as we think about those challenges with daycare, with childcare and daycare, and the challenges of logistics of trying to get that done, we really felt like it was more equitable to get all of our learners back. So live streaming, in terms of some of the larger school districts, I would say that the jury is out. For instance, one of our neighboring districts hasn't started it yet. It certainly is part of their plan, a large part of their plan. And every one of us is unique. The unique thing about Rochester Community Schools is we started a virtual platform. And we also have the ability to move back and forth. So as we consider live streaming, I think we've got to be realistic about it. There are a number of unintended consequences that have to be considered legally. There are a number of unintended consequences that can be considered ethically, particularly when it comes to some of our neediest learners sometimes that need intervention, and then classrooms that need debriefing. So I think it's not as easy as an answer, unfortunately, like nothing is in COVID, of we can just do this and then we'll have more synchronous learning. I also think, in listening to the educators and talking to many of them, that and I had a meeting earlier today about this, they feel strongly that they're getting meaningful time with students in a way that's safe, and they're also very committed to making the asynchronous time rigorous and making sure that it's supporting the time that's in the classroom. I think one of the things that we find out when we're in this remote environment is, as parents, we get a little look behind the curtain of what goes on in school. And we may, again, I think Vygotsky calls it an apprenticeship of experience. We all know about school because we went to one, but school has drastically evolved over the past, I don't know, in my case, 30 years from the time that I attended one, 30 plus years. And when we think about the advent of learning platforms, we think about all the abilities to have real-time communication. I think it's a different experience. And the notion that we're just going to flip on a camera on a computer and all is going to be right with the world because our students can see their teacher talking, I think we've got to be very careful about that assumption. Is streaming something that we'll continue to watch? Is it something that we'll continue to consider as a team? Absolutely. But as we move forward, our team is really committed to staying focused on the schedule that we have with this blocking, that I really find it interesting that I've been in education finally long enough where something that's old is new again, which in terms of blocking. But our team, I want to reiterate that our plan has been developed by a very large team of people that are very committed to making sure they're keeping kids safe, they're not adding to risk, we're mitigating. And on top of that, we're delivering instruction in that environment that's effective and that's flexible should we have to shift back and forth. So I very, very passionate about this. I think streaming potentially could have a possibility at some point in some applications, but I think it's as a blanket application, we're going to have to wait and see how it works in some of these other districts that are solely focusing on that. Does that help, Barb?
Yeah. I just wanted to follow up. So, as I said, there are families that are concerned. They don't necessarily like the remote or the virtual option for their children. They're concerned about sending them back into the classroom for various reasons. Either they have some health issues with family or extended family. And so what do you say to those families who might want to hold back their kids from trying this phased in approach if the remote learning is no longer available and they know that the virtual campus did not fit with their particular child's learning needs?
I would ask them, first of all, step one is to connect with us and let's see what your needs are, see what your concerns are. We've always been focused on accommodating people. And we'll continue to do that. And again, I think it's important. I think because technology sometimes seems like it's a panacea to us, right? Again, we can stream and it'll be just fine. If anyone's been in a first grade classroom, for instance, and watched a teacher work with a first grade class, it's very, very challenging with the technology. I think Bridget mentioned that. But I want you to imagine a teacher managing 5 or 6 kids on a screen and 10 or 15 kids in their classroom, and thinking about how to do that effectively and giving everyone their due attention. I think what I would say to those parents that are, and I've talked to them, and they're legitimate concerns. I think the thing that we have to realize is we move back and phase in, and we've said this about our teachers, we've said that about the staff here at the administration building when we stood back up in June. The fear is real. The fear that people are feeling is real. It's something that they have to process, and it's something they have to move through at their own comfort level, almost like grieving. So I would ask folks that if they have challenges in terms of remote learning and they have a situation where they may have to stay in it, get a hold of your building principal. Let's figure out what those accommodations might be. If a shift to a virtual environment would fit, we can do that. But let's start with a conversation about, okay, we have these challenges and we think remote's going to work for us because we don't feel safe sending our kids back for whatever reason is. I would really urge people to reach out to their building principals. If for some reason they're not comfortable with doing that, please reach out to us.
Thanks, Bob.
Yeah.
Bob, I know that we've had, lots of parents who are concerned about the asynchronous portion.
Mm-hmm.
And, obviously no one really knows what that looks like. And I think there's a lot of anxiety over that and the fear that, their kids will not learn what they should be learning in a regular year. My question is, in 3 or 4 weeks, if it doesn't look like we'll be able to go back in person, how will we be evaluating this to determine whether remote is a better option than the hybrid model? Or which one has the pros and cons instead of potentially just staying in the hybrid, potentially for the rest of the year if the numbers never drop so that we could do in person?
Yeah. Hey, Lori, it's kind of interesting that we have a large group, the slides on with the large task force, because we're talking about a team response. But Lori, can you take that slide down so I can see everybody? Thank you. I appreciate it. That's a really great question. And I think, again, I don't think we want to commit to anything that's certain in this time. But I do think we've got a lot of stuff going for us. First of all, we have a really talented team of people, and the folks on this call are only representative of it, and boy, are they really talented. I think as we consider moving forward with the hybrid and we look into November, and if there's a potential of COVID and flu colliding and us having a more serious situation, I think a couple things will happen. First of all, we're going to evaluate this on a daily basis on its effectiveness and how to move forward and how to tweak it and change it and how to make it even better. But I also think that we've got to have the courage that if we have to wholesale shift something, we might. If we were going to, and maybe even testing in public health, the public health response will get even better than it has been in the last 2 weeks. But as we think about moving forward and if this platform doesn't work, or it's something that's got to be wholesale changed with it, we're going to have the courage to do that. And I know that doesn't make our community happy because they want certainty and they want consistency, but we're just not in an environment where that's something that we can guarantee. And I know that, again, I know that's not what people want to hear, but that's the truth of the matter. And I think when I listen to Monica talk about what her asynchronous looks like, and Bridget and Sarah, I think there's a lot of teachers in the school district, most of our teachers, 99.9% of them, because, maybe there's that 0.1%, are committed to making sure those asynchronous days are really important and very rigorous and very worthwhile. But I want to say this as well. So often we get emails about, this isn't working or that isn't working for my student. And that's well and good. I'm happy to help. As a matter of fact, I kind of enjoy solving a good problem with a parent and advocating for their child. But I would also urge you that if you have a misgiving or a concern about that asynchronous day, or that whether or not the kids aren't going to learn on those days, talk to your child's teacher. Have a communication with them. Have a discussion with them about, hey, what's that asynchronous day going to look like? Or I think about it at elementary school, you know, hey, here's my circumstance with my kids in those asynchronous days. I might be able to do this at this time, but I won't be able to do this at that time. So I need you to work with me. I think this is a really, really important time for us to come together as a community. I think it's an important time and an exciting time for us as a staff as we think about continuous improvement. And it's a little bit of a scary time because we have no idea what's going to happen with the virus. And we may have to have the courage of our convictions to shift again if our educational platform determines that and the virus data determines it. And that's a whole lot of uncertainty right there.
Yeah. I think you bring up a great point, Bob. And I think, you know, the onus is on us as a community, right? We can open up the school, we can have the mitigation procedures in place and the protocols in place within a school building. But we also have to have an understanding that the families have to be a part of and play a role in ensuring that, you know, they're partnering to disclose if their, you know, child is not feeling well or if there's an issue. We all have to play a part in trying to make this work. But, you know, my biggest concern is we're transitioning, and I think we're doing it in a very thoughtful and pragmatic way. But to your point, we're dealing with a very unpredictable and novel virus on top of a flu season that we're heading into. So, you know, my biggest concern is that we have this great phase in, and we've got kids in a great kind of routine again. And then we have to start to shut things down again. And then we have this pattern of opening and closing and opening and closing. And I, you know, talked with a parent who said, you know, they didn't feel that was any better for their child than, you know, a remote situation. So it's a catch-22. It's extremely an extremely tough situation, but I truly appreciate all the thoughtfulness that went into this presentation tonight, because I mean, I don't know how anybody could have sat through this going on now for 4 hours and not recognize how just how thoughtful and how pragmatic everything has been in terms of this. And the other thing I want to point out too is that by law, you know, we have to relook at this and reevaluate what we're doing in 30 days.
Yep.
So it's a great opportunity for us as a district, you know, in 30 days from now to say, okay, where are we at? What's been working? What do we need to tweak? And move on from there with, you know, wherever we're at in terms of this novel coronavirus. So I can't express my thankfulness really to the teachers that are on this call tonight. Your energy and enthusiasm, it just makes me really excited for the kids because your energy is projecting through this virtual format, and I can only imagine how excited those kids are going to be when they get into your classroom. So thank you for your dedication to, you know, everything that you've been doing up to this point. Anyway, I could go on for days. I'll let somebody else talk.
Kristen, I'm not sure who could answer it, but I just wondered if someone could talk about when students and or staff do need to quarantine, how will those students receive education? Like what will be the instructional plan for those 14 days or 10 days or 24 days that they need to be in quarantine for?
Yeah, and that's a question we're grappling with, and I know we're not alone in that. Initially, I think it needs to be, number one, figured out at the individual level. We don't know how our families will respond if they have a positive or case in their household, or they're in a situation where they feel they need to quarantine. We don't know how the individual student or staff member will be feeling in response to any being positive with the virus. But, you know, in short, what we've built and what we've been working on and really the environment we started in gives us opportunities to continue students engaged in on-pace content. So much different than, maybe 2 years ago or last year, where we're scrambling to get a packet together for theirs. So there's work to do for a child at home who has to be out for a fever or whatever, and just to try to keep them engaged a little bit in schoolwork. Well, they'll actually have access and resources that teachers can post through our learning management systems that continue the alignment of what would happen. And then again, I'll reiterate how I started. I think the most important piece is for us not to assume what a family may want during that time or may need during that time, and having that individual connection to come up with a plan in those situations for those individual students who may be quarantined, and then also supporting our staff if they're in that situation as well.
Yeah, I feel like we have more tools at our disposal now than we did a year ago with that. We've done some pretty creative things in helping students that were that had some medical issues long term. I can think of particularly one student at one of our middle schools that actually had a robot going around in his place, which was a pilot through Beaumont Hospital. But I can assure you that the principals and the teachers that are on this call, based on individual need, will deliver the goods when someone's in that situation. And if it's a situation where it's simply somebody that's asymptomatic and in quarantine, we have a lot more tools at our disposal now than we did a year ago, and a lot more know-how, whether that be connecting at Zoom at the end of the day and going through the stuff that's in the learning management system, or whatever creative things these teachers and these administrators will come up with. I always felt good about that when we had a student that was in need, that we could help them and meet their needs and help that family through a difficult time, whether it be a medical situation or whether it be a terrible family situation. And now I honestly feel even better in terms of the tools that we have to assist even more.
And I guess I would say, while I agree that we certainly need to be flexible, I also think we should have something that's systematic, whatever word you want to use, so that there's a starting point, and that we have a game plan, so that when we have our first case of a team that now has to quarantine for 14 days, that we have somewhere to go, rather than trying to create, 35 individual education plans.
Point well taken, Michelle.
Mike, I know you'd had a question earlier.
Yeah. So what about the quality? I think there are a lot of people that are concerned about their kids falling behind. Because we're switching from one teaching and learning mode to another mode, and we're losing a lot of time, and because of the different modes, not getting as much content to the kids as we should be. How can we be sure that students are getting the instruction and learning what they're supposed to be learning, for the year?
Mm-hmm.
I could speak to it a little bit at secondary. One of the nice things about our structure of learning for teachers is that we have not only the curriculum consultants like Monica herself for every subject area, but we have teacher leaders, and they've been working all summer and putting together great plans. And if a teacher is struggling, they could reach out to any of the teacher leaders or curriculum consultants for some ideas on how to make that asynchronous strong. But also those same groups determine what are the power standards. What does every kid really need to have? And so a teacher is not out there on their own trying to figure out, oh gosh, I only have this much time. How should I use it? That's already been decided. They did this in groups. They did this back in March. Like, what are we covering? What are the power standards? They also know what didn't get covered in the spring, and they're making up for that time as well. So there's a lot of communication and a lot of collaboration that has always been a natural part of the way that we do business, that allows us to make sure that every student is getting the same education across the board. So at secondary level, anyway, I think that works pretty well. And I believe that with the teacher leaders and the grade levels at elementary, it works pretty much the same way.
Yeah, very similar process. Really engaged with our program consultants, our learning consultants, teacher leaders, our CTL groups, which we've mentioned on a few occasions tonight, and our building leaders as well, to really capture what are those priorities. these discussions have been ongoing since last spring of reevaluating our scopes and sequences, what needs to go where, when, and most importantly, why do those things need to come then for particular grade levels. In the reality is, if we go back to our roadmap, we're going to try to capture as much as we can within this year. But the Opportunity Labs roadmap had us looking in a 2-year systemic view, especially for our younger learners, and trying to get back any learning loss that was there. As much as, you know, we say negative things about benchmark assessments sometimes, especially out of frustration when we just want to teach kids. We'll have some data that we can pull and initially look at, plus other formative assessments that will be ongoing and that can take place in a remote learning environment and also in person. So we're going to know our kids, we're going to know what they need, and then we're going to be able to react and respond in an appropriate way at the classroom level.
Monica, do you mind if I put you on the spot? I just think you're in a unique position
Sure.
with being a parent in the district and being a teacher and having and playing an integral role in us being able to respond to this pandemic. Do you mind?
No, I don't mind at all. So, Mr. Zabit, what I wanted to make sure that people realize is that school is no longer just a list of facts that we are asking kids to memorize. It's more about the how and the application. So whatever we do with kids, we're really focusing on how they think, how they talk, how they calculate and figure out problems. And that should be able to be applied to any of the unit challenges that we're doing in let's say, science. So I think if we're really focusing on those, like Wednesday, I mentioned the skills. How do we analyze data? How do we make an argument? How do we provide, just this is a perfect example. How do we get evidence that proves what we want to say? So if we can apply those ideas to all of our different subject areas, our kids are not going to be behind because they'll know how to do the things. I'm seeing that with both of my students at home as well. If we focus not so much on, oh, I'm trying to learn chemistry, but how do I apply the ideas of chemistry to make me able to solve something, then it becomes a different picture and a different discussion. And I'm not sure if that answers your question, but it's really a different mindset.
It does. I guess maybe, you know, Corey talked about assessments. That would be a good topic for another work session, to give us some sense of how we're doing. You know.
So one of the things we talked about earlier today is, you know, when we can focus on something that's not the beast that's COVID, to start to really get back into a work session rhythm where we can start talking about exactly what you brought up, Mike. What is the instructional impact? How has it changed? How are we changing our approach in the classroom? What does that feel like for our teachers? What does that feel like for our building administrators and our leaders? We think about the principals that are on this call. They've had a whole bandwidth of extra duties that have been put on them that I'm certain they did not go to administrator school for, that they didn't find out about in an internship, and they certainly hadn't done it in their first parts of their career. But I would like to give them an opportunity at some point in the future for the board to come back and talk about, you know, really what we're here for is that instructional leadership and that social emotional support for our kids. And, you know, if we're being honest, the honest to God answer to your question is we don't know. We don't think they're falling behind. We think we're doing the right things. We certainly have people that are dedicated and love these kids very much and are willing to do anything they can to make sure they don't fall behind. But I think if we're being honest, the answer is we don't know. We don't know what the other systems around us are potentially having kids fall behind in either. I don't believe they're falling behind academically. I would put the product of this school district up against anything in this state. I don't think that. What I do believe is it's time for us to get our kids back in front of kids if we can, and I think we can. We can double down on those relationships and those commitments and those connections, and then kind of take it to the next level and assess. You know, What are those academic connections? What is that progress? What do we need to do next to improve it if we need to? I think we've been in reactionary mode for so long now. It's hard for us to think about proaction and think about innovating. And I think that's the thing that I'm most enthused about with this meeting, in addition to the connection and the love that I hear in these teachers' voices, but how much innovation has gone on that we're going to have to step back and reflect on and really think how it's been implemented in our system. I think we're going to find out some pretty amazing things have been done on behalf of kids by these folks. Yeah. And I think they may not be falling behind. They may actually be accelerating. I don't know, but I think that's a wondering I have in my head. You know, when we've asked kids to be more independent and apply their learning in a different way, yeah. maybe the falling behind isn't what those of us that went through a more traditional educational experience, maybe it won't be as much as we think it is.
Dr. Shaner, could I just add something to that? Because I was thinking that same thing you were just mentioning. Is the mom of a current freshman and a sophomore in high school here in RCS. I've heard my own kids and I've heard other administrators and teachers talk about the silver linings. And I think we tend to get stuck in these ruts of thinking what we're missing, but we are gleaning so much from this process, the way we handle PD, the way we handle office hours with students. My own daughter was sharing how she liked that she could have the one-on-one with her teacher and stop in for office hours. This isn't something that we had in a traditional format. You might stop by for some after-school help, but more opportunities to connect in easier ways and collaborate with other schools during PD. There have been a lot of silver linings that we don't want to lose sight in all of this.
Yeah, I totally agree with you, Lisa. Sorry, I'm going to jump in again. I really think, you know, this kind of ties into, it felt like forever ago, but the gentleman who came and kicked off our, you know, kind of new phase of vision, and he talked about our
Bill Daggett, yeah.
Yeah, and, you know, while this is something that feels so encompassing and engrossing, and we just feel like we're just working to keep up with the change and try and keep up with this virus and what it's throwing at our teachers and our district. But I really think this could be one of those tipping points for education, that educators for years have talked about, you know, what does the future of education look like? I think you're living it right now. You're teaching in it right now. You're being forced to because of a novel coronavirus, but you also are being able to capture a time where, you know, you're being pushed into an uncomfortable spot. And as educators, as parents, especially you brought up that very point that, you know, as a parent, you know, this was not the, you know, model of learning that I had growing up. And I'm sure most of the parents in our district haven't. So we're witnessing our own children going through something that is pretty revolutionary, I think, in terms of education and its delivery. So I think, you know, to Lisa's point, we need to still look for those silver linings and have a debrief, because I think this is a good way to force us to kind of have a future focus. You know, it's not perfect. We definitely want kids back in front of students back in front of their teachers, but it certainly can inform, you know, how things could be different in terms of learning for kids in the future. So I promise I won't talk anymore tonight.
And I do think, you know, as we talk about the innovation and the unknown, I think we also have to talk about the hardship. There are a lot of people in this community that have hardships that this is very challenging to. It's challenging to all of us, but I'm talking about folks that we have real significant hardships that are going to need our support, that are going to need a creative response from us in order to continue to educate their kids at the level that is expected and is demanded. So I'm confident about the work of this team. I've never been more confident. You know, it's tough, right? We all have our own experience, and it's tough to sit and really reflect on what we've been through and what we're about to continue to go through. But I feel very confident about what this team has given us to move forward with. It's given us what they've given us to adjust from if we need to adjust, and really what that innovation is going to have in terms of impact into the future of this organization and on kids. So they're you know, I get accused of being overly positive sometime, but as you can see, when you work with folks like this that are on a Zoom call at 10:20 at night and they've got to get up and teach tomorrow, it's hard not to gush on them and appreciate their hard work.
Thanks, Dr. Shaner. I am reading Andrea's mind, and she has one super quick question. I'm reading her mind. She promises it's very quick, and then we're going to wrap this up. Andrea.
I do have a quick question. I am just wondering if you guys can speak quickly to, especially elementary, what will they be doing as we make this shift with their extracurriculars, so art and music and all of those very important things in a school day? How is, I don't know that was addressed tonight, and I would like to make sure that we know how that's going to happen, especially for the little folks.
That's a really great question. Specials, C.A.R.E.
Yeah, so working very closely with our content leader teams, our initial plan back in July was to have those special teachers visit the classroom for cleaning purposes, space and movement purposes, and remaining in a cohort. It is still the idea, but we're working within the scale-up approach. So how will we, basically, what's the best way to reintegrate special staff to get back in front of kids? So there'll still be an asynchronous component to it, as we need to balance the amount of exposure they have throughout the course of the day and the amount of classrooms they visit, so we don't lose the integrity of our—
Corey, just speak to that in real numbers for a minute, because I think people don't realize that our specials teachers on any given day see potentially hundreds of kids.
Yeah, so even with a reduced density on a normal schedule, they'd be visiting 8 to 9 classrooms on a typical day. And when you think of the enhanced cleaning protocols that we have, when we think about reducing density to try to mitigate risk and having adults travel room to room, it's not ideal. So we're looking at creative solutions to phase in to live instruction. Again, luckily we have the right team and the right people thinking of different avenues. Asynchronous will certainly stay a part of that, but we also know that some of those folks are the key relationship to a lot of our students at school as well. And it may be, right, depending on shifts within building and staffing, it may be one of the most familiar faces they have upon return. So there's going to be a scaled in approach to get them back to connecting live without losing sight of those asynchronous lessons that have been ongoing.
Okay, so I'm going to sum up. So yes. Initially they'll probably be mostly asynchronous, and as you're phasing them into getting some in-class time on their 2 days while they're in live.
Yes, and then working with the balance around cohorts, right? So we have to take into account that only half of our kids are in a class at each time. So really creative solutions of potentially looking at 2-week bands, going chunking by grade level. So we're limiting the risk of the amount of classrooms they're getting. So we'll have some very creative solutions to that as we learn more again, and using this as another part of our scale up to where we want to be with is 5 days of full instruction.
Okay, thank you.
Okay, so I wanted to just really quickly summarize, because I wrote these notes down, just a few big picture ideas that I heard tonight, and then we'll go on with public comments. So number one, essentially it's our goal to get back in person 100% when it's safe to do so. We don't know when that will be, but this is the first step. I heard Dr. Shaner say that a couple different times in a couple different ways. Number two, we are not eliminating risk, we are mitigating it, and we are watching the data based on what we've been advised from public health officials in the county and the state. If you're not comfortable sending your child back, reach out to your building principal, and we will work with you. We're committed to working with families. And finally, we will not let our kids fall behind. Those are the 4 big ideas I had. So with that, I'm going to close up the presentation. Thanks to everyone who participated. If you are one of the teachers or principals, if you need to leave, I will understand that. Thank you very much for your time. We're going to take comments from the public. So comments will be limited to 3 minutes. And if you can, when I unmute you, if you can state your name and your relationship to the district, and I'll just go in order of what I see in the queue here. So I'm going to start with, I see L. Brown. It's an initial L. And then after that, I'm going to go to Leonara Garcia. So L. Brown, you should be unmuted.
Can you hear me?
Yes.
I have 2 high school age children, one of which is still in the district, one of which we have moved out for this year. But so my question stems to the high school, even though most of your meeting was elementary school. I would like to know how you can possibly think that going from a normal school week, which gives you 295 minutes per class, 59 minutes times 5 days a week, down to the 180 minutes that they're getting under the remote plan was already concerning, down to 140 minutes of this return to whatever, is how you can even fathom that they're getting even a portion of the material that they would in a normal year. And please don't say we'll make it up later, which is what I've been told numerous times, because kids that are into AP classes, especially 1 semester AP classes, these kids were put into them first semester, which is already shorter than second semester. And now they're being cut up, you know, their time is being cut into this way. And there's just no way they're getting the material. And it's not about how happy or loved they feel or what materials, you know, they can make up later or what they think in how great, you know, how they can analyze things. 2 + 2 always equals 4. And that's what they need to learn to do these AP exams come May.
Thank you. Next up, we have Leonara Garcia, followed by Nina Ignazik. Oh, let's see. It looks like Leonara, you're using an older version of Zoom. You need to be promoted to panelist. Let me come right back to you. Let me make sure I know how to do that one. So Nina, you're up. Sorry about that.
Okay, thank you for letting me speak. My name is Nina Ignazik. I have a 7th grader at Hart and a 9th grader at Stony. I've been listening for 4.5 hours, and I truly appreciate the amount of thought and effort you put into the goal of getting kids back into buildings. I am truly surprised, however, by the speed and aggressive timeline you're taking, and I'm not in favor of my children returning to school at this time. I don't want to be educated or told to work through my fears. I want to be told what option I have to help them continue their education while not being in the building at this time in Rochester Community Schools. And if there is no option, I'd like to know that so I can make other plans. Thank you.
Thank you.
Kristen, do they know, just to make sure so we can get back with them, or they're making sure we have their information, correct? Could you just remind them?
I believe we're collecting, Christina, I believe we're collecting their information, or we'll send them, we'll get their information from them. Yes. So Leonara, I am going to promote you to panelist. I think that's the only way I can get you on here. Are you there?
Yeah, I'm here. Can you hear me?
Yes.
I just have a question. I'm not going to make a bunch of comments because I think you're working really hard, so I'm not going to make a bunch of comments. But I have a question about, so like I'm in 10th grade, right? So last year in 9th grade, I was supposed to take the PSAT in April, I think. So like, am I going to take it this year, or are we just skipping over that, or what? Because I think the PSAT is really important because I'm going to take the SAT soon. So like, I'm just wondering about that.
So you're asking about the PSAT, right?
Yeah.
Are you, and you're an Adams student?
Yeah, I'm an Adams.
Okay. All right. Thank you.
Mr. Cusmano, you got that one? Follow up tomorrow?
Yes, for sure.
So I have Jessica Opfer next, and then I have Jill Willis. So Jessica, you should be unmuted.
Okay, can you hear me?
Yes.
All right.
I'm going to talk fast. My name is Jessica Opfer, and I'm the parent of a North Hill 3rd grader and a Hart 7th grader. I have the perspective of both the remote and virtual campus environments as we started our kids in the virtual campus, but switched them to remote. I am speaking tonight, and I know most of you have heard from me already, to request that the district continue offering remote learning to those families who are currently uncomfortable with returning to school in person and who find the virtual campus unacceptable. I am not advocating for any further delay in the return to in-person learning for those who want it. My ultimate goal is to see my kids attend school in person because I know that's the best thing for them from both an academic and social emotional standpoint. But for many, my family included, the virtual campus proved to be an unacceptable experience. Students were pulled out of their homeschool community, separated from familiar teachers and classmates, eliminated from many desired classes, including advanced and AP courses, forced to follow an unfamiliar independent learning schedule, refused special education services, and required to juggle an unreasonable workload scattered across multiple online platforms. I know children and parents across all grade levels who have literally had emotional breakdowns due to the shortcomings of the virtual campus. By making this the only long-term remote option, families have been forced to choose between their students' physical and mental health. For a district that prides itself on its attention to social emotional well-being, this constitutes a failure. In the end, many families chose remote over the virtual campus because it most closely resembles the academic and social environment to which our students are accustomed, allowing them to maintain their connections to their school community in an environment that more closely mimics a typical school day. Families who chose remote over the virtual campus are now once again being forced to make the same agonizing choice: either send our kids back to school in person before we consider it safe, or leave our home schools where many of our students are functioning successfully and join the virtual campus. The district has created an all or nothing scenario in which the parents who want or need in-person learning have been pitted against those who want or need to continue in remote. It doesn't have to be this way. This is a conflict of the district's own making, creating this horrible atmosphere of animosity and negativity, setting parents against parents and parents against the district. At a time when we need to come together as a community, we have literally been torn apart. We've talked briefly today about live streaming. There are some other options, identifying teachers at each school who continue to teach their grade level or subject matter in the remote environment. I'm not trying to be an expert or say I have all the solutions, but there are clearly viable options out there that must be explored, especially when we consider the need to handle quarantines or rolling closures. I want to add in here very quickly today, I heard a lot. I'm really not that worried about my kids academically. I know they're going to be okay. They have great teachers. This is a blip in their academic career, and I'm here to help them get through that. But they desperately need that social emotional connection to their school and their classmates and the normalcy of a typical school day, even if it's via a computer screen. I'm asking the district to allow those students who wish to remain remote to work out temporary accommodations with their teachers and administration. But most importantly, I'm asking the district to focus on developing a long-term plan for continued remote learning that provides a healthy social, emotional, and academic environment for all of our kids. Thank you.
Thank you. Next up is Jill Wills. Jill, you should be unmuted.
Okay, hi, can you hear me?
Yes.
Okay, hi, thank you. My name is Jill Wills. I have a daughter who is a junior at Stony Creek High School. I do have 2 younger children, but they attend private school in the area. I just want to say briefly that while I'm very happy that my daughter is going to have the opportunity to come back to the in-person classroom, I am very, very concerned about the limited amount of in-person instruction. She's a junior. This is her most critical year to try to get into college. And, you know, even with all the asynchronous time, and even though she's very intelligent, it's just not enough to get, you know, everything that she needs. You know, I know someone earlier mentioned AP courses, and there is a certain amount of information that needs to be covered in those courses, and it just can't be done in the amount of time that these kids are going to be getting. And I've spoken with Dr. Shaner, and the thing that I've come to terms with is that this is hopefully going to be for a very limited time. And so that's why I'm kind of going along with it and hoping and praying for the best. So really, I just have a question at this point. We talked about the cohorts, but I'm trying to understand kind of from a realistic standpoint and the day-to-day how exactly they're going to work. So just want a little bit more clarification. I'm assuming, for example, cohort A, let's say there's a math class, calculus. On Monday, they're going to be learning lessons 1 and 2 in person. I would assume cohort B would then be learning those same lessons 1 and 2 in person on Thursday, so that the teachers wouldn't have to, come up with 2, live lesson plans, et cetera. So I guess my question is then, what are the children in cohort B doing on that Monday and Tuesday? Like, for example, October 19th, when they come in for the first day and cohort A is learning new information, what is cohort B doing on that Monday and Tuesday? And then also, I guess, going forward on Wednesdays, for example, I know we said there's going to be a half an hour for each class, but if the kids are at different points in their learning, how can anything, new instruction or anything like that actually be accomplished? Is that just going to be more for questions and, taking attendance? I would actually hope that that could be a time for more learning and new instruction, but I guess I'm just wondering how that would work, because I think that the kids are going to be at different points, if I'm understanding how the cohorts are going to work correctly. So that's just my question. If I can have some more clarification on the cohorting and the actual day-to-day, how it's logistically going to work. Thank you.
Yeah, I think that's a good question, and one that we will communicate to the community, because I think that needs some more explanation. Next, we have Karen's Dashninger, and then Grace Varghese. Karen, you're up.
Good evening. Can you hear me?
Yes.
Yeah. Okay, thank you. Thank you for this time this evening. Yes, my name is Karen Steininger, and I'm the mother of a first grader at Longmeadow. One of my questions for my family, as I'm sure many families are thinking this evening as well, it remains to be our ability to be successful during asynchronous learning days. And I really have a desire to avoid some of the power struggles and the frustrations that we experienced this spring. Not at all anything on our teachers. It's just something that happens when mom tries to tell you what to do. My question tonight is whether the district has considered or would be able to provide either substitute teachers or student teachers to help guide our students live during this asynchronous learning days. I certainly realize our teachers are doing amazing things, and they likely have plans to work together and find efficiencies in preparing for these days, but having somebody at the ready who can help guide our students live and better support our families would definitely be something that I think would help our family continue to be successful through this experience. Thank you.
Thank you. Thanks for that suggestion. Next up, we have Grace and then Andrew. Grace, you're unmuted.
Can you hear me?
Yep.
My name is Grace Varghese, and I'm currently an 11th grader at Rochester High School. I'm here to plead with RCS and give my point of view. This hybrid plan isn't going to work. Many teachers nationwide are under severe stress from the absurd workload that's been given. We have a teacher shortage, and it's only going to get worse if we go through with the hybrid plan. If you aren't sure if your students and your own staff are going to survive when going back to school, why would you experiment with their lives? It makes no sense. I chose remote learning because I relied on the district to make the right calls when it was safe. Virtual campus is a disaster, according to many of my friends who take it. I can't believe I have to make a choice between my education and my health. Michigan's 3 biggest universities are staying online as much as possible for the entire year. Why are we experimenting with children? Teachers are dying, parents are dying, students are dying. Even if they are not, there are still the long-term effects that result after, like the loss of taste and asthma. There is no guarantee for safety here. Even if you pollute the air with chemicals to keep everyone safe, there will always be a chance of COVID transmission since it's through the air. Many teachers and students from different districts are complaining about the headaches and the difficulty breathing due to constant disinfecting and exposure to chemicals. I expect the district to follow science and not experiment with human lives for a small, loud group in the community. They are not the only ones in the RCS district, so we need to think of everyone involved, not just those parents. Not everyone who chose remote wanted to go back. Many of us felt like there wasn't a choice. I started a petition 13 days ago. In that short amount of time, I got 1,000 signatures to stay remote. I am clearly not the only one that believes we should stay remote. Many teachers are coming to me voicing their concerns over what's going to happen to their health and families after going back. They feel like the district doesn't care about them and it only cares about its reputation. Please listen to your staff. They are very concerned. Thank you.
Thank you, Grace. Next up, we have Andrew, followed by Christine.
Can you hear me?
And yep, you're unmuted.
So I have two sons at Brooklands. I'm also married to a teacher, thankfully not in RCS, because unfortunately the teachers have been let down by RCS. I believe they are all working extremely hard. The two that my boys deal with, I think, are doing the best they can, but in no way are they providing adequate education. I think if we're being honest with ourselves, there's not an educator that would say that this is a quality form of education. They might say it's the best we can do, but they would not call this a quality form of education that anyone's receiving. I think you're hearing that from all sides. The virtual side's complaining, the remote side's complaining, the people that want to be in person are complaining. So I think, again, if we're going to be honest with ourselves, we haven't addressed any of the actual problems, and it's because, unfortunately, the leadership here has tried to make everybody happy. Unfortunately, we have to look at the data and make a plan that works. And I want to highlight one thing that I found a little bothersome. There was a real focus on making sure that we followed the legality of busing because of it having to be equal and providing that equal opportunity. That applies to education as well. And multiple people on this call had said that this new plan puts the onus on parents. Every parent cannot provide the same level of education. That by nature says that everyone is not receiving the same level of education. So it's going to force people to start looking at legal matters because we can't sit down and just look at the data and come up with a reasonable plan. And the fear mongering that's going on leads to what you just heard in that last call. If we want to look at Oakland County data, there is a 0% death rate from 0 to 19. You have to get to 40 to 49 age range to get to 1.25 death rate. You have to get to 60 to 69 to get over 7% death rate. So yes, there is a risk to the virus, but data can tell you where it's at. Data can tell you how to control it and how to mitigate it. So at this point, you have a community that is all upset. You have a few people that want to sit here and continue to say, yeah, we're doing the best we can, but we have failed the kids. We have failed the teachers, and they are the ones feeling the brunt of this. Thank you.
Thank you. Next up, Christine, and then Zach. Christine, you should be unmuted.
Hi, hello, can you hear me?
Yes.
All right, well, thank you. Good evening, everyone. I'm Dr. Shaner. My name is Christine Habib, and I have a 4th grader at North Hill and 6th grader at Hart. Initially, back in August, when we were given the option to choose between virtual academy and in-person school, we chose virtual because we weren't ready to start school on September 1st. Once RCS announced we were going remote, myself and countless others switched over from virtual to remote, while other families switched to remote just only a week into virtual academy. Those reasons include parents seeking a more regimented schedule that mimics a typical school day, more face-to-face instruction time with the teacher, especially for students who need more guidance and assistance throughout the day. Many of us also realize that not all AP classes or extracurricular are offered through virtual. And with only 1 hour of instructional or pre-recorded classes and 5 hours of independent studying, it seemed like the most logical decision was to switch to remote. Most importantly, we wanted our homeschool teachers and students that we know and are comfortable with. Rochester Community Schools puts a lot of emphasis on our child's mental health and well-being, and I felt that remote was given us the structure, comfort, and familiarity that would have been available to us had it been a normal school year. I realize that this is an entirely new academic platform and changes do not happen overnight, but virtual isn't an option for many of us right now because of its limitations. So please consider one of these options so that those of us who would like to stay remote can do so. Dedicating 1 remote class per grade for elementary and per subject for secondary to a teacher who's interested in staying remote. Let me elaborate and explain what this third option really means. There may be teachers who are not comfortable teaching in person at this moment, but don't necessarily want the virtual option either. Maybe a teacher who needs to take care of their ill parents, for example. She can then volunteer to stay remote, and this would be the same idea for every other grade. This would be a win-win situation for teacher and families who would like to keep their kids remote. Second option could be to live stream classes for remote students or temporary students in remote learning who are quarantining. I think this investment into this equipment will give us flexibility in the future, even beyond COVID. Other public school districts have and are making this work as we speak. I think having one of these options is a happy medium that allows both parents who want to send their kids and the parents who are interested in staying remotely at home. Thank you for taking the time to listen and making our kids' safety and well-being your utmost priority.
Thank you, Christine. Next up is Zach, and then followed by Silvana.
Hello, thank you so much for giving me the opportunity to speak. My name is Zach Tippin. I am an 11th grader that goes to Rochester High School. I know you guys have been doing a lot, and I can obviously tell by the 4.5-hour presentation, and I think it's really great that you're taking this much care. However, I do think that this is ultimately accomplished very little. This is a very status quo option. You've, like many people have said before me, Andrew, Jessica, Grace, you've tried to please everybody and hence pleased nobody. No one is happy with the amount of education people are receiving. Nobody is happy with the fact that it's not fully remote, not fully in school, it's not stable. There are many things that could have been better, but I do not think they will be. As a school district, I would like to be able to place my trust in you guys that you would make you would be the bigger person, make the bigger call. If there's something like a pandemic that perhaps right now is not a big deal, but would get inconsequentially worse by allowing many people into a single building at the same time, I would hope that you would make the bigger call to at least wait until the end of the year, at least until data says it is basically null threat. I love the sympathy to staying in person and seeing people face to face, but I do not think it outweighs the fact that connections are still being made between teachers and students, because quite frankly, I think that connections such as social ones are ultimately made via effort, not by merit of just being in the same room. I hope this doesn't become political, nothing like that. I just hope data is what drives these decisions. But I ultimately don't think it quite matters what I hope. Same thing with teachers. I do not think it quite matters what they had hoped either. I think many teachers are uncomfortable after starting a petition, and along with Grace, if you might have been listening, we've gotten messages from many teachers who have reached out to us to say, hey, we can't speak up about this, but we are really concerned. And I think this isn't just something in our district, it's something all over the world. And if we're going to be aggressive about it, then not taking teachers' accounts into account is only going to hurt everybody. You would admit that it was high risk, you would admit it that it was a low agreement. I do not understand where the benefits of this plan outweigh the many losses. And at the end of the day, though, as I stated before, the virus might not be a big deal, it will get worse. It will not get better, no matter how remote, no matter how clean you think you make it. It's not like when they sanitize a spacecraft. It's just wiping down the tables. It isn't going to be enough. If you're really worried about not spreading the virus, don't open the schools back up. And if you aren't worried about it, what on earth are you thinking? Thank you.
Thank you, Zach. And the final comment will be from Silvana. Silvana, you're unmuted.
Hi, before I start, I just want to say I'm thankful for all the teachers. I'm thankful for the board. But I just wanted to say, to reach a bipartisan agreement, our first step is regarding this hybrid plan. There needs to be a change. It's not going to work for best terms for both people who do want to go back and people who don't want to go back. Considering these factors, the hybrid plan includes 2 days of self-learning, which raises the questions, will students be capable of teaching themselves? I'm a junior at Rochester High School, and personally, I don't really know if I can help myself during those 2 days. So far, this hybrid plan makes people want to go back to remote even more. So if we're going to push forward, we need to think about asynchronous learning, and there needs to be a change. Thank you.
Thank you. So with that, I'm going to take a motion to adjourn the work session, and we will take a 5-minute, very quick 5-minute, how about 4-minute recess, and come back and continue on with our business meeting, because we have to get to the actual business at hand. Moved by Andrea, seconded by Michelle. All those in favor, please unmute and say aye.
Aye.
Aye. And so we'll be back here at, I have 10:48 right now, so we'll be back here at 10:53.
Can someone start my video for me, please? Pretty please.
I just got you. Did you get it?
Yep, thank you.
Okay.
Appreciate it. Nobody wants to see the mug.
All right. I see 1, 2, 3, 4, 5, 6, 7 faces. All right, so let's call the meeting, the business meeting to order. I have 10:54. Roll call. We have all members present in Zoom, and we have 2 items under new business tonight. The first one, item A, is approval of the extended COVID-19 learning plan. This is an action item. Dr. Shaner.
Thank you, Madam President, for your consideration this evening is our extended COVID-19 plan. As the board knows, this is our plan in its entirety, and this is done by the Return to Learn package of laws that was signed by the governor on August 20th, and we respectfully ask for the board's consideration and approval.
All right, so I will take a motion to approve, and then we will have discussion. So motion to approve the COVID-19 learning plan. Moved by Kevin, seconded by Andrea. Discussion or questions? Michelle.
I guess just comments that as we know from emails we receive, from comments, that there's anxiety, there's anger. I think we have to remember that, that COVID task force has been talking about this for 6+ months, has been going through over all the options that are out there, and the community hasn't been involved in that. I think that we need to, as we go forward with this, I think we need to make sure that we are reevaluating what we're doing. And I think we need to get communication out to the families, whether it's a handbook that I've seen other districts do, but data and information for them so they know what to expect on each days, what their responsibilities will be. I think we just need to provide more data and information, and also who they're to go to if they have issues and aren't comfortable returning, who they talk to specifically about their issues.
I was going to actually mention that too after the work session. So the presentation video and the presentation slides will be available on our website tomorrow. Correct. Where can our family easily find that?
Say that again, Kristen, where they can find the presentation.
I think
Lori will have it on our website. Yep.
Okay.
Yeah, and Kristen, up if you look at the main page of our website, there's 3. It's the tab to the left, and that's where they can find all of the information related to a Return to Learn plan, and we'll be sure that the slides get up tomorrow.
Kristen,
yeah.
Matt's got the participation rates as part of that too. Matt, would you like to?
Sure. As part of the recertification, we have to announce the participation rates via the 2 interactive communications. This is a great example of how guidance has changed since August 20th when this was first announced. They initially released how 2-way interactive communications would qualify the district, and that was simply emails or phone calls for the most part. A week later, they updated to include live instruction, and then there was another memo from MDE earlier today that gave another option to qualify for that. So this data isn't complete as the month isn't over, but for week 1, we had 82% completion for the 2-way interactives, which is live instruction or emails or phone calls between students and teachers. I'd like to remind everyone that week 1 was a holiday week, so we only had 2 days of instruction during that week. The week is Wednesday through Tuesday per pupil accounting. Week 2, we had reached 95%. Week 3 was 95.4%. And currently week 4 is 94.7%. That rate will go higher as there is still the rest of today and tomorrow to calculate for these participation rates.
That's essentially, when you say participation rates, that's essentially attendance, right?
It's attendance. We also have the option if students didn't attend, and most students do attend live instruction at least twice per week. But there's also the option for a teacher to email a student about specific core content or content. And there's specific qualifications that the student has to respond. The teacher has to close that loop with some feedback, not, good job or, makes sense. So most of that is participation. When I look at the data, there are, anywhere from 5 to 15 students that accomplish the two-way interactions by another method other than live instruction.
And did the state give a benchmark? Do we have to be at a certain rate or?
75%.
Okay.
And in a normal given day, it would not be unusual for us to, in a normal situation on COVID times, it would not be unusual for us to have 10% absentee rate.
Okay. Okay, any other questions or comments from the board or from the public on our return to learn plan? Again, this is something that we have to approve every 30 days.
So my question, well, I don't know if it's valid now, but re-looking at the plan in 30 days, we'll be evaluating what the past 30 days have been like, or in 30 days, could we possibly be voting on a completely different idea?
Or you could be voting on the exact same thing.
Okay.
The law requires that you recertify the plan every 30 days, whether you change it or you don't.
Right. Okay.
Andrea, you had a question?
Just a comment, thank you. I'm just wanting to, well, I guess it is kind of a question and a comment. To piggyback Barb's question about just the recertification and all of that. Obviously, we know that we have a lot of unhappy folks in the community. We have a lot of folks who are uncertain. We have a lot of folks who are just fine. So there's this spectrum. Can you summarize how much of that the task force has taken into consideration in making these decisions? I know we want to say data, and we want to say science, and we want to say Oakland County Health Department and teachers and district and admin and all of that. How much have we also taken the time in this to listen?
Well, we respond to every one of these, every inquiry we get, with the exception of the ones that become abusive. So I think we all internalize that quite a bit. I don't, if anyone thinks that you get the visceral emails and talk to us as that we have, and it doesn't affect the way you think about things, I guess we wouldn't. I don't know how that's possible, I guess, is my point, Andrea, but I want to bring up another point about recertifying the plan. So you think about this, because we're kind of in an off time here, right? So we recertify the plan, we're doing a hybrid plan. We're not really implementing our hybrid plan essentially for another week, right? A week and a half. So I just want you to bear in mind that, once we get up to recertifying time again, we may not be in a position that we would have changes. I don't know, but I just want you to be aware that is because of the time we have to recertify and the time it's going to take us to scale up and implement, that there may not. I just don't know. There may not be a lot of change.
Okay.
Because you might not be through it.
And then the comment following the question, really is just that reminder to us that this is such a unique moment, and we know that so many parents are uncertain about whatever they're feeling, right? And we've made this motion to move forward and talk about this, this piece and this learning plan, and moving towards hybrid is what the admin is seeing and what the experts on our team that we trust are saying. So, I'd like to use my comment time to just say that, given all of the feedback and the concerns and the fears and all of that, as a parent myself, and the struggles that we're facing, that the admin is saying that this is still the best idea, that moving forward, given all of the mix, is still the best idea. And so I don't know, I felt like I needed to just reiterate that as a board, we've heard everything, and we've also heard everything that the admin and teachers and science and data and the actual experts have to say. We don't know everything because it is really still just a fast moving situation. But given all of that, that it still is the best option at the moment, in the moment, for our students. And I think that's something to remind all of us as we're hearing what admin is giving us, and as we're making this decision moving forward. So just wanted to take my moment to say that.
Just real quick in response to Andrea, I just want to, and I appreciate that very much. Just want to be clear that the board's approving a plan that includes a hybrid, remote in person, and a virtual campus, and actually a return to full face-to-face.
Well, and I just, just to piggyback that, since we're chatting now at 11:05, we're in the virtual academy, and so and we have quite a few friends who are in the remote learning, and just that spectrum of viewpoints and opinions. And again, that's the piece that there's not a one size fits all answer here, and so there's no way for us to please everyone. We have these options that are at our disposal, and we have this data that's at our disposal to make the best decisions for this, large group of students, and their safety and their education and their health and all of that stuff. And so, I think that's really complex, and I want to make sure that we just remember that. Before I close then, since I started talking again, I just also want to just remind us that if we want this to be safe, and if we want this to work, it is really on all of us, as educators, as board members, as community members, we could choose to stop arguing about this. We could choose to mask up and go to school 2 days a week and sort through this very difficult situation in a very difficult year. So just that, small challenge from a board member sitting in the corner of her bedroom at 11:06. I think we really could do that as a community, and we're going to have to, if we want our numbers to stay low. We're going to have to think of every other kid in class. So just that's my thought, my 2 cents.
That was a great 2 cents. Thank you. Thank you for saying that. We do have one comment from the public in Zoom. So Rosalinda, I'm gonna unmute you.
Hi, I just want to, to say thank you to everyone for doing what you guys are doing. I know you guys are doing a really hard work. You guys, as everybody is telling you all the time, you guys can please everyone. But all the comments that I'm hearing is the kids are complaining, especially the high schoolers. They're saying they don't want to be back. They're saying they don't feel safe to be at the schools. They're saying that they prefer to stay home and take their classes from home. So I just want to let you know, guys, that just please keep thinking on an option for them. Because unfortunately, virtual, because I have a kid on virtual as well, he's in elementary, and unfortunately, it's not working for him at all. Why? Because it's totally independent thing. It's not related to a school at any level. So he's just, the teacher is not performing as she should be doing. And as well, he's not connected with his friends or anything like that. So for my daughter who is in high school, this system wouldn't work because she's taking APs and honors and everything. So I just want to let you know, guys, again, just repeating what all the kids are saying, that just please consider the options like to keep them remote if they need it. Because as well as you guys said, that you guys don't have an option is some kids get infected with the virus. So you guys need to have that option. So just let us know what you're gonna, what is the plan, because you guys didn't say anything about it. Thank you.
Thank you. Any other comments from the board or from the public? Mike.
Yeah, you know, Andrea made the 2 points I wanted to make, so thank you for that. I just want to, you know, double check and say, you know, this is, you know, with all the comments that we've gotten, all the letters that we've gotten, we have heard, and we have this plan. Is it perfect? No. But I have a group of people in front of me that tell me they're going to make it work. And these people have not let me down before. And I'm going to support this plan because I trust the people in front of me to make it work and do right by the children of this community. That's all.
Well said, Mike. And, you know, the funny thing is the responsible, as far as my estimation, the responsible and the logical, critical thinking that has gone into this by so many is to be appreciated, I think, of the highest order. I mean, you guys have done a hell of a job with this. And by no means, and this is just a personal sentiment, I don't think that we've been reactive to the pressures of community. From every decision that I have seen come through here, it's been basically based on 4 cornerstones, and you've kept them as the end in mind and everything, including what we've done in summer all the way up into today. And that is the health and safety of kids, making sure that they can get the best learning possible in the environment that exists, keeping in mind of community and the parents, and lastly, being fiscally responsible for our district so it doesn't go into the toilet financially. I mean, those are like the 4 big outcomes that have always been at the forefront of every move that this group has made. So when you're focused on the outcomes like that, and you're evolving your plan based on new information that comes down the pipe every few weeks, like it has been, to Andrea's point and to Mike's point, feel confident and strong about what you're doing, because it's the right thing. And hell, like you said, Bob, this might not be the way to go. Maybe in 30 days or 60 days from now, we got to switch it up and pull it back or step it up. But we're in a fluid process, and just don't lose heart on what you guys are doing, because I have a lot of respect for it. And you know, if I saw holes in the game, I mean, you know, I'm one that talks. You know, I'm a talker. I get on my rants. If I saw something sideways, I'd certainly let you know. But I think you guys are doing a hell of a job.
Thank you so much. All right, so I guess we'll call for a vote. All those in favor of approving the COVID-19 extended learning plan as presented, say aye. Please unmute and say aye.
Aye.
Aye. Opposed? That's a 7-0 vote. Next item on the agenda is it's a business item. Dana Taylor is going to tell us about it, and my browser just closed out, so I can't even read the name of the actual item. So I'm going to let you take that, Dana.
Thank you, Kristen. Actually, Matt is going to take the approval of the landscaping project. Thank you.
Landscaping, that's what it was. Yes, thank you.
Thanks.
All right, so we have one bid award being presented tonight for your approval. It's the landscaping project. On July 23rd, 2020, the district advertised a request for proposals for landscaping improvements in the local publication, the Rochester Post, and posted RFP documents on the purchasing pages of the district's website, the state of Michigan procurement website, and BidNet Direct. The district received 6 responses on the due date, and bidding closed on August 6, 2020. A virtual public bid opening was conducted online on August 6, 2020 at 2:30 p.m. The scope of the project includes landscaping improvements at 2 school buildings, Ruther and Van Hoosen Middle Schools. Proposals were evaluated by the Director of Capital Projects and Facilities, Pete Musio, and consultants at Grissom, Metz, and Andrews Associates, a landscaping architecture firm. Based on this information, we recommend the district award the Landscaping Improvements 2020 project to C.A.R.E Landscaping Incorporated in the amount of $139,011.
Thank you. I'll take a motion to approve the landscaping improvements as presented. Moved by Mike, seconded by Michelle. Discussion or questions for Matt? Discussion or questions on this item, on this particular item from the public or board? It's pretty straightforward. Thank you. Seeing none, I'll take a motion to approve the landscaping bids as presented. I mean, I already took that motion. Sorry, I'm a little tired. All those in favor, please unmute and say aye.
Aye.
Aye. Opposed? That is a 7-0 vote. So that concludes the actual business part of our meeting. Additional business, we do have time for additional public comment at the meeting and or board or administration comments. I'll open it up to any and all of those right now. And remember, if you're with the public, to identify your relationship to the district and keep your comments to 3 minutes. So I see Beatrice. Beatrice, you're unmuted.
Hear me?
You're not super loud.
Oh, let me
Oh,
talk to my.
I hear you now.
Okay. Hi, my name is Beatrice Sarkozy. I am a mom for 2 kids, one at West Middle 6th grader and a 9th grader at Adams. My question to you, after hearing all these parents and everybody, I do appreciate all the work you do, but I think until the kids are actually tested to see where they are, you cannot say they will be ahead or behind. And I presume when these kids are tested, you will compare with what happened 2 years ago and not last year. So after evaluating the tests, when these kids will be tested, will you consider if kids are left behind to extend the school year into the summer so that they get all the education or not? That's what I would like to know.
Thank you for that question. I think I don't think there's an answer to that question just yet, but we can communicate more information when Jessica. Jessica, you're unmuted.
All right. You already heard a mouthful from me, but I just want to say you voted on this plan. We expected you to. We didn't expect it to go the other way, but please keep the dialogue going. Okay. We're not just going to sit back and say we lost it tonight. There's a lot of people who are still very unhappy. There's a lot of people who don't feel like they've been heard because they don't feel like they've gotten much of a response back other than, oh yeah, we're listening. We need to have an actual dialogue. It can't just be people like me speaking up at a public meeting and not having anybody respond. That's not being listened to. It is being listened to, but we don't want to just be listened to. We want to actually have a conversation. I want to know what options are being considered to keep remote going further for the people who need it. I want people to get back to me. Other people want you to get back to them. We want to know what we can do to make this work. So please don't just say we've done this, we're going to do this for 30 days and see how it works. We need to keep talking about it. That's all I'm asking for right now. Just keep working on it because we're not quite there yet. Thank you.
Thank you. I appreciate that. Thank you. Any administration or board member comments?
Yeah, I do need to take a minute and extend gratitude to all of our teammates that joined us this evening and really hung with us all through the evening, and all the work that's been done. The board visited a couple of buildings and Kelly gave a great tour. Brian Shelson gave a great tour of all the things that were being done at Stony Creek High School. Plus we got to see the bond work But I do just want to extend gratitude to everybody on this call, including the parents that have hung with us. This is very difficult work. And again, thank you.
Thanks. I do see one last public comment, and that is from Sarah. Sarah Mish.
Hi, everyone.
Hi.
Can you hear me? Okay.
Yes.
Oh gosh, hold on. Sorry. Okay, pulling it together here. If I know many of you, and if you know our family, we are all RCS all the time. My husband and I both work for Rochester schools. Our 3 children attend Rochester schools. We love Rochester Community Schools. And obviously we want nothing more than to be back in the classroom with our students. My concern is, and I'm sure I am not alone in this circumstance, I have students that receive special ed services who unfortunately, because of that, were not allowed to be part of the virtual academy. So they were put into the remote setting. We've been happy with the remote setting. It has been working as well as it can. I mean, obviously it's not the most ideal situation because we know we'd love to be in the classroom with our students, every teacher would. But it has been working pretty well for them. However, with them returning, they are unable to return due to just medical fragile circumstances. I had to leave my position at Rochester High and go to the virtual academy because of this. And so my children are unable to go back into with remote. I keep hearing, we have a plan, we have a plan. It seems that it's going to involve some sort of a homebound services. I have not heard any answers to this. My kids are asking me for answers on this. I don't know what the plan is for students that receive IEP service. I have an IEP and are medically fragile. It seems there's room to either be medically fragile or there is room to have an IEP, but does not seem to be room for both. And I think this is a population of our student body that has been forgotten in this particular circumstance. And I don't know what can be, I don't know if there are answers that just haven't been rolled out. I have been reaching out to get answers, and I have not been able to get any answers. So Sarah, I don't know what the plan is.
Sarah, this is Bob. I got your email today. We'll be in contact with you in the morning.
Okay. My concern is I'm not the only family that is probably in this circumstance. So I just don't know how
I understand, Sarah.
I
just want you to know I got your email earlier today.
Okay, thank you. So that is just my concern, something that I think, because I listened through the whole, however many hours you guys have all been on here, and you guys are awesome. Like I said, like I love Rochester schools. I love our school board. I think you're very supportive. Our administrative team is awesome. I have defended this school district. If any time someone said, well, I don't agree with it, I'm like, you don't know how hard these people are working. They're amazing. So I come at this 100% as I know you guys will come up with a great plan. Just that I'm not alone in this. There are other parents that are sitting there not knowing what the plan is. So that's that. But I think you guys are awesome. Let me just say that.
Thank you, Sarah. Thank you. Thanks. All right. And with that, I'm going to take a motion to adjourn the meeting at 11:22. Moved by Michelle, seconded by Barb. All those in favor, please unmute and say aye.
Aye.
Aye. Aye.
Opposed? Motion passes. Meeting adjourned at 11:22. Thank you.
Thank you.
Thanks to all of you. Thank you.